Good morning, everyone. We'll get started in about 2 minutes.
Good morning.
Okay, we'll get started. So good morning. My name is Councillor Chris Moyes, and I am the chair of the Confronting Anti-Black Racism Advisory Committee. The clerk has confirmed that we have quorum, so I will call meeting number 3 of the Confronting Anti-Black Racism Advisory Committee to order. And again, welcome to everyone. This meeting is being held in person and using the city's WebEx technology with members and staff connecting by video conference or calling in. For some reason, my eyes are blurry. I don't know why. Working too hard. Because we are meeting in person and remotely, we ask for your patience with any delays and technical issues. Members of the public can watch the meeting streaming live on YouTube at youtube.com/Toronto City Council Live. I would like to remind all staff and invited participants who are joining the meeting remotely to keep your mics muted and your video turned off, unless you need to address the committee. This will make it easier for me to, as chair, for those watching on YouTube to see the members as we debate and vote on agenda items. Members, please keep your mics muted unless you wish to question staff or speak on an item. If members wish to ask questions of staff or to speak, please make sure your video is on and raise your hand, or unmute your mic and indicate your intention to speak, and I'll create a speakers list. When voting on an item or a motion, I would ask members to turn on your video and raise your hand to indicate your vote. If there is a recorded vote, I will ask you to state if you are in favor or opposed. Members, I want to remind you that although we are participating remotely and in person, we must still submit our motions in writing. The clerk's staff are available at cabrac@toronto.ca to help with motions. Although we are in different locations, the Confronting Anti-Black Racism Advisory Committee acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I will turn it over to Lucinda to share the African ancestral acknowledgements.
Thank you, Councillor. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers, as migrants either in this generation or in generations past, and those of us who came involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to these ancestors of African origin and descent.
Thank you. May I have a motion? Sorry. May I have a motion to confirm the minutes of the Confronting Anti-Black Racism and Advisory Committee meeting on February 9th, 2024? Waleed, all those in favor? Opposed? Carried. So the first item is CR 3.1, an overview of the Our Health, Our City strategy. As chair of the Board of Health, I am pleased to see this presentation come to the committee to help advance the CABRAC priorities on mental health. First, to track and provide strategic advice to enhance and target the city's mental health initiatives. And second, advocate for the widespread implementation and use of race-based disaggregated data to inform decision-making, improve services and programs, and to directly benefit Black residents, accountability, transparency, and local community governance system. So to do this well, we need to understand TPH's strategies focused on mental health and support around substance abuse, which is often an area where Black communities encounter discrimination in policing. I am pleased to welcome staff to talk about Our Health, Our City, which focuses on substance abuse and mental health, and how this plan will benefit and support Torontonians, but specifically some of the challenges we see in Black communities. Vanessa Fletcher, Associate Director, and Katie Millen, Senior Policy and Strategic Issues Advisor, Toronto Public Health, are here to give a presentation to the committee. Where are you at? You can go ahead.
Okay, can everyone hear me okay? Great. Thank you very much for the invitation to join you today. And thank you for the opportunity to bring forward an update on Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for Toronto. My name is Katie Millan. I am a Senior Policy and Strategic Issues Advisor, leading our mental health and substance use strategy team here at Toronto Public Health. So Our Health, Our City is a comprehensive, citywide 5-year plan that includes recommended actions for addressing the full spectrum of both mental health and substance use concerns facing the city. It was recently adopted by the Board of Health in November 2023. As we work on implementing this strategy, we look forward to ongoing collaboration with our partners, and together with support across city divisions, the community, healthcare sector, and other orders of government, we hope to make a meaningful impact and improve health and well-being across the city. As part of our presentation today, we will also share our proposed approach for the upcoming year, which includes establishing an implementation panel that will help guide the work in the strategy. This implementation panel will ensure that we continue to hear directly from individuals with lived and living experience of substance use and mental health challenges, and that we continue to build upon the momentum we created through extensive community engagement we conducted to develop the strategy. We know that substance use and mental health occur along a spectrum, from good health to illness, and this strategy includes plans and partnerships designed to support everyone. Next slide, please. That said, we do know that there are many issues causing increased mental health and substance use related harms for all age groups and populations. These issues are not unique to Toronto, but I'd like to share some of this data with you today. Sorry, the font's a little small there, but it is estimated that as many as 1 in 5 Canadians experience a mental health problem or illness every year. Approximately 500,000 Canadians miss work each week due to mental illness. This leads to $6.3 billion of lost productivity annually. And the Center for Addiction and Mental Health has stated that we are in a mental health crisis. Unfortunately, evidence shows declining rates of mental health throughout Canada and stressors affecting mental well-being across the lifespan, including in Toronto. In 2021, only 55% of adults in Toronto reported very good or excellent mental health, which was a significant drop from 71% in 2017. Overall demand for mental health services has also been increasing across the province, but only an estimated 28% of people in Ontario feel that mental health services are easy to access. We also know that the mental health impact of the COVID-19 pandemic was further pronounced among some groups, including ACB communities. There is a long, damaging, and stigmatizing history linking populations to mental illness, but mental health issues are not intrinsic or inevitable features of any social group. Their existing disparities are the product of systemic discrimination, violence, colonization, and cycles of poverty and precarity. This leads to disparities in access to care, and we know that a 2018 study using the Community Health Survey in Ontario reports that when compared to white respondents, mental health service use was generally lower among South Asian, Chinese, and Black respondents. Next slide, please. So in addition to mental health, our strategy also includes a focus on substance use and addictions-related issues as well. And as you can see on this slide, again, apologies for the small font, alcohol produces some of the highest burden of drug-related harms and deaths in Toronto. In an average year, alcohol is linked to 803 deaths, 4,469 hospitalizations, and 39,419 emergency room visits in Toronto among those 15 years of age and older. Cannabis, which was legalized in 2018. In 2022, approximately 29% of people over the age of 16 in Ontario reported using cannabis for non-medical purposes in the past 12 months. And tobacco, of course, is still on average responsible for 2,564 deaths, over 11,000 hospitalizations, and almost 16,000 emergency room visits. This is annually in Toronto among people aged 35 and older. So finally, just to continue providing the landscape overview, we also remain amid a devastating drug toxicity crisis. Next slide, please. This crisis has taken far too many lives across the country and also in our city. In 2022, preliminary reports estimate we had approximately 509 opioid toxicity deaths in Toronto, which is a 271% increase since 2015. With access to a full continuum of care and supports, these are all preventable deaths. As you can see on the bottom left of that slide that's a heat map of suspected opioid overdose calls to paramedics by neighborhood between January and December 2023. You can see a few things when you look at this map. What it tells me is that there's certainly a concentration of these calls in the downtown core, but it also shows me that substance use occurs all across the city. Next slide, please. So it's against this backdrop and with this information in mind that we received direction from the Board of Health to develop and deliver an updated and integrated strategy for the whole city. This is a strategy that builds on decades of work that you can see on the slide, including the Toronto Drug Strategy from 2005, and it's also well aligned with different provincial and national frameworks. Next slide, please. My team conducted over a year and a half of community engagement with over 200 participants on 18 community roundtables. We conducted 84 external stakeholder interviews and 30 interviews and roundtables with people who use drugs. The Deputy Mayor also hosted a mental health roundtable in June 2023, and all of these events were opportunities to hear from community, experts, and also people with lived and living experience to help shape the vision and the recommendations included in the final strategy document. I'll also note that as part of this engagement, we hosted a series of population-specific engagements, and for ACB communities, this included an ACB roundtable, key informant interviews with organizations including the Black Coalition for AIDS Prevention and the Substance Use Program for African, Canadian, and Caribbean Youth, as well as a key informant interview with the manager of CABR. Taibu Community Health Center, which is a CHC dedicated to addressing systemic barriers and providing essential healthcare to Black identifying individuals, joined us for the Deputy Mayor's Mental Health Roundtable in June 2023. So this engagement led to the development of this vision for the strategy. Next slide, please. I'll just read it out for you. The vision is that Toronto is a diverse and resilient city that prioritizes the mental health, well-being, and safety of all residents, where everyone can access the healthcare, services, resources, and community spaces they need to support their mental health and prevent substance use-related harms with dignity and ease, where mental health and substance use are addressed as health issues rather than criminal issues, and mental health and substance use stigma and discrimination have been eliminated. Oh boy, another very small font slide, apologies, but there are 7 goals and 5 key principles embedded in the strategy. The principles are health and safety for everyone, meaningful inclusion of people with lived and living experience, anti-oppression, anti-racism, and decolonization, evidence, innovation, and continuous improvement, as well as being citywide, collaborative, and comprehensive. Goal 1 is to promote mental health and well-being across the lifespan. Goal 2, to reduce and prevent harms and deaths related to substance use across the lifespan. Our third goal is to expand access to a full continuum of high-quality, evidence-based, client-centered services. This would include prevention, harm reduction, and treatment supports. Fourth goal, to advance community safety and well-being for everyone. Also to improve access to housing and other social determinants of health. Goal 6 is to support mentally healthy workplaces and optimize the mental health of workers. And finally, goal 7 is to proactively identify and respond to emerging mental health and substance use issues. I'll also note that this includes using data to inform our research and policy changes, as well as improving our reach and utility of the Toronto Drug Alerts, which we issue when we become aware of issues related to toxic drugs circulating in the community. Next slide, please. That's a long list of action items, but we do have 4 year 1 priorities for the city. Year 1 is this year, so we're well on our way. Our first priority is to advocate for ongoing and sustainable funding for shelter services and increase funding for supportive housing. We are also hoping to achieve ongoing and stable funding to establish a 24/7 crisis stabilization center. Third priority is to, again, advocate for ongoing and sustainable funding to collaborate with first responders to improve the transition point between first responders and hospitals. And finally, to advocate for ongoing and sustainable funding to expand the TCCS to be citywide, which I think you'll hear about a little bit later this morning. I mentioned at the beginning that our work to develop an implementation panel, so I'm happy to report that we're in the process of standing that up. All advice from this panel will be shared with the Board of Health. Next slide, please. This panel will include 6 individuals with lived and living experience, as well as 6 experts from the mental health and/or substance use sector space. The applications recently closed and are under review, and we plan to bring back our proposed membership to the Board of Health in Q3. So finally, I'll end with questions, and I wanted to say thank you very much again for your time today. We do have one question for the committee, which is, from your perspective, what should we consider for priority areas of action in year 2 of this 5-year strategy? Thank you very much.
Thank you. You were succinct. Any questions for the panelists? Walid, go ahead. You have 5 minutes.
Good morning. Thank you so much for your presentation. It's really unfortunate that we're in the midst of a crisis, especially when it comes to the rate of people dying from overdosage of drugs. I was, when I was thinking about your presentation, the one thing that stood out for me was and maybe you can correct me if you did consider this, but the lack of culturally appropriate interventions, whether it's therapy, whether it's engagement. I just would like to find out more from you on whether that was discussed, by your team. Was it part of your priority setting? And I can speak to my experiences in Regent Park, where we have WNSA, which delivers culturally appropriate therapy, and it was funded by the federal government. And I'm wondering if we are doing a scan of which organizations or which initiatives in our communities, in this very diverse city, where there's a culturally appropriate approach to addressing this ongoing crisis. Thank you.
Thank you very much for the question through the chair. Yes, this absolutely came up through multiple tables of engagement and is hopefully reflected in some of the recommendations. I didn't go through all the recommendations. There's quite a long list in the strategy, but I will say that Goal 2A, reducing toxic deaths, and Goal 3, expanding access to the full continuum, we have sub-recommendations within those goals to implement population and culturally specific services. So absolutely, we agree this is important. We heard this from our engagement. They are specifically called out in the recommendations in the strategy, and we hope to work with our community partners to ensure increased access to culturally relevant and safe and specific and supportive services are available.
Okay.
Yeah, thank you for the question.
Go ahead. Sorry, Kathy, go ahead.
Thank you for your presentation. And just sort of to tag onto what Waleed was saying, what struck me as I was looking at the presentation is the heat map.
Yes.
And in the heat map, it showed that there was a concentration of calls sort of in the downtown core, and not very many in what would be majority Black neighborhoods. And the question is why? Okay, so is it because there's a preponderance of drug substance overuse in the downtown core? I doubt that. And so you have mentioned in this report and in your presentation here the historical legacy of sort of structural racism and the criminalization of drug use. And so in this plan, the question is what are we doing in order to address those things, which might then encourage people to actually make these calls? And I think that's important. So I'd like to hear a little bit more.
Of course, yes. Thank you again for the question through the chair. Actually, can we go back and put the heat map back just so everyone can take a look at it? It's a great question. And when I look at that map, I do see that there's substance use across the city. So starting from this place, we can take a data-informed approach to how we target services and interventions going forward. To the point I think that you're raising about the stigma and discrimination and the criminalization of substance use currently, we know that that's a barrier to accessing care. We do, and as part of our work to develop our Made in Toronto model of decriminalization, we had an ACB community working group, and they actually developed a report specifically focused on the disproportionate impact of criminalization on ACB communities. So this is one of the reasons why exploring alternatives to criminalization is included as a recommendation. It's one of the reasons why this work continues with support from the Board of Health. And it absolutely is a barrier to accessing care, among many. There are many barriers here to overcome, including other social determinants of health. So it's a broad strategy. It does include these social determinants of health as well. But when you actually look at the specific impact of criminalization on access to services and as a barrier, it's one part of our approach to increase access to a full continuum of supports and services. So one example would be we have supervised consumption service sites across the city. However, they're currently all located south of Bloor Street. It's a great evidence-based place to start. Thank you.
Thank you so much for the nice presentation. I was impressed when I listened to you about how you're going to access, your strategy of access to housing at social determinants of health. And I was curious and interested to hear more about how you're going to address as a social determinants of health, especially education and employment for the youth.
Yeah.
In your presentation, you showed how mental health affects the youth, 44%, but also in the same line of what Walidi and Kathy are talking about, we are looking at the major causes of why are the youth using drugs.
Yeah.
And some of those are social determinants of health.
Yeah.
So when you look at your one-year plan, if you could go to that slide.
Yep. Sure. Oh, it's at the very end. Sorry. That's okay. Way there. This one.
Yes, no, that one.
Yeah.
Yeah, so you are looking at housing.
Yes.
Right. I was expecting to look at some other major social determinants of health, especially in direct concern with the youth.
Yeah.
I don't know if you do have some work or talk about that, or you have that kind of work.
Sure, thank you. Thank you for the question through the chair. Absolutely, is one of our key priorities for the first year of the strategy. It's also a 5-year strategy. It's also a strategy for the whole city. So we're working very collaboratively with city divisions and city partnerships. We actually have an internal city division implementation table where we can speak specifically about this strategy with our city division partners. So while Toronto Public Health isn't necessarily directly responsible for implementing this full continuum of recommendations included in the strategy, we're working with our partners and setting those priorities collaboratively. So right now, some examples is we're partnering to look at supportive housing and looking at a range of harm reduction services that we could, incorporate more in supportive housing. We are looking at what that looks like, how to standardize that, how to make sure that we're prioritizing based on that map where we can see the concentration of need, where we can, really direct the investments and encourage our partners to direct their investments to increase access to this whole range of services and supports. I would also say there are calls for partnership with our provincial and federal counterparts here in this strategy, because, all the social determinants of health require partnerships with all orders of government to actually make a meaningful impact. We don't have that lever ourselves specifically in Toronto Public Health, but we hope that this strategy provides that consolidation, that strategic alignment, that vision for what we hope to achieve together, which can then advance some of those funding questions, which will really make the impact. I hope that answers your question.
Yeah, that's wonderful. But when you look at these strategies, to me, they seem to be addressing the symptoms, what currently is happening. But we are not looking at the major causes of this. And I was expecting that the strategies would be looking to address the causes, other than looking at harm reduction, because you are preventing harm reduction on someone who is already using drugs. But what is causing this person to use drugs? That's what we should be looking at.
Maybe.
We are looking for the causative factor, not to treat, the symptoms which are already existing because, So I think the strategies should be focusing in that direction. And that's why I'm talking about employment, education, right? These are some of the pieces which could be missing among the youth or the populations which are highly affected with mental health. So if we are to look at the strategies, we need to go back and look at the real causes, not trying to address how can we keep people surviving as they use drugs, right? Because these strategies are doing that. You are preventing harm reduction. You are making access to naloxone to prevent overdose. Is that solving the issue?
Maybe I can help here as well. And thank you for those comments. These are very important and considered comments. And at Toronto Public Health, we do try to focus the upstream interventions, the social determinants of health. And so Our Health, Our City strategy fits within that broader context. So I just wanted to flag that, we're also working on a strategic plan at Toronto Public Health that's going to focus on those social determinants of health, guided by the Board of Health, to make sure that the levers are being turned at the upstream level, so that, like you said, to prevent these types of things. So just to say that we're absolutely aware of that, and trying to understand where we can best invest to make those preventions happen.
Okay, thank you. I think I saw Effie's hands up. Yeah. Go ahead.
Okay, can you hear me?
Yeah.
Okay, great. So once again, thank you for being here. I do have some questions just in terms of the staff that kind of makes up the committee that kind of came up with this basis to then come and get community consultation. Is your staff, and I'm asking, is how diverse is your staff? Because it's great that you guys have come up with this and then you're coming to groups like us and then other community groups to kind of get our input, but are the people forming these initial policies or strategies diverse? Is your staff diverse? And then on top of that, when you're doing community consultations, are those positions or those consultations also paid, or are you asking for them to volunteer their time?
I'll start with your second question. Thank you for those questions. We do provide an honorarium for individuals with lived and living experience for all engagements, so that is compensated, yes.
As for your first question around diversity, I think that's something that we at a staff level have to do better at. But when you look at the senior management of Toronto Public Health, it is very diverse. But as you kind of come through down, there's work to be done there, absolutely. But we definitely take direction from our senior management that does represent lots of, I don't know, my mic's going off there. They're a very diverse group of people.
And Shannon, go ahead.
My question is sort of following on some of my committee members' comments, questions, but just thinking through the plan further, and I can appreciate that in year one, the priorities are maybe more symptomatic. I'm thinking through sort of some of the cycles that we see of addiction and mental health and where that intersects with criminal justice and some of the petty crimes that are associated with this cycle. And is there any plan or any thought around the plan, whether now or over the 5 years or at whatever point, that some of that cyclical behavior is going to be addressed? Because often we see, when people are in a cycle of addiction and in a cycle of mental health challenges, that there is a lot of, I would say, petty criminal behavior that's attached to it. And when that, when people are also in the criminal justice system, that obviously has a compounding effect on drug use and mental health challenges. So I'm curious how this plan will intersect with some of that.
Thank you for the question through the chair. It's a great comment to raise, and certainly we will be guided by our implementation panel, which includes community representation, to scope the priorities going forward with the strategy. So I would say that that's absolutely something that the next years of the strategy could focus on. We are also planning annual report backs on implementation efforts. So we will be collecting and analyzing information from across the city, which would include our partners at Toronto Police Service as well, to report back annually on the progress against these recommendations. So we're hoping to monitor, we're hoping to set priorities that are dynamic and responsive to emerging community priorities and trends. And so this is something absolutely that could be more of a focus going forward in year two and throughout the strategy as well. So again, we'd be working closely with our partners at Toronto Police on any enforcement issues related to these topics too. Thank you.
That was it? Okay. Let me just ask if any members online have any questions. I think we've exhausted the room. Queen, go ahead. You have 5 minutes.
Yes, I just wanted to ask questions regarding waitlisting for priority groups. I was wondering, is there anything being done to shorten the time span to get services?
Thank you for the question through the chair. Healthcare services are the responsibility of the provincial government, and they do track wait times to access certain services. I think the organization responsible for that is Connects Ontario, specifically for mental health services. I think they do track those wait times. We are encouraging and advocating increased access to the full continuum of mental health and substance use services and supports in an effort to see those wait times go down. That's one of the reasons why one of our priorities in the 4 first-year priorities is the implementation of a 24-hour, 7 days a week crisis stabilization space, because currently we don't have access to that in Toronto. And that's, an important foundational building block to be able to move forward and ensure people have access to the right care at the right point in the services and support spectrum. We don't want people going to the emergency department necessarily for some of these services. It's not the right place for them to go to get the best care. We can do better, and that's one of the reasons why this 24-hour, 7-day-a-week crisis stabilization space is one of our first-year priorities for the city to achieve.
Thank you.
Okay, thank you. We can do a second round, but 3 minutes only, okay? Wally, go ahead.
This time I'm going to be answering your question. Since you posed a very important question, which is, what should you focus on year 2 as a priority? So when I look at your presentation, and I just want to commend your team for working on such important priorities. I think a robust educational campaign is critical.
So are we speaking or are we asking questions?
I'm answering her question. She asked for.
We'll have an opportunity to speak. So right now it's questions to staff.
I don't know how to phrase this because you asked a question. So I'll pose it as a question for you. Do you think a robust educational campaign will be beneficial in year 2, specifically by working with city services, whether it's the Toronto Transit Commission, whether it's Toronto Police Services, whether it's Toronto Community Housing, as the largest social housing provider in our city, and what are your thoughts of engaging communities that usually are not noticed in our city, those that adequately need resources, and how do you plan to work with Toronto Community Crisis Service, TCSS, in implementing that educational campaign and sort of a plan of action to ensure that those that are not seen are engaged in this process? Thank you.
Thank you for the question and comments through the chair. I think this is an excellent area to explore, and we'll definitely bring that back and ensure that that informs the discussions for year 2 priorities. In terms of working collaboratively with our partners in other city divisions, we often amplify their work, and we are closely engaged with them to support their actions and their projects as well. So that's one of the reasons why the interdivisional table is a great place for collaboration and amplification and support of all the other initiatives going on at the city as well. But thank you for the feedback about an education campaign.
Thank you. Go ahead, Lucinda.
Thank you so much for the presentation. And I just want to echo, first of all, a lot of what my fellow committee members have tried to emphasize or have really beautifully emphasized, is that there is kind of this overarching perspective or framework of the social determinants of health in, I think, in what you're attempting to do. However, it's not immediately clear, at least for me, what sorts of policy and legislative and upstream levers you're really focusing in on for this plan. And you speak to different levels of government having more sort of influence over those sorts of levers. And I work in policy, in public health policy at the federal level, so I do understand different jurisdictions having different levels of influence, right? But I do think interventions at the local level have such a powerful impact and can have such a powerful impact in community. And so I want to understand what Toronto Public Health is doing to advocate for local needs in other governmental spheres? What are the exact like policy and legislative, I guess, perspectives that you're advocating for, you know, at a broader level? So thinking through like affordable housing you speak about, and also like decriminalization, petty crime, minimizing, you know, imprisonment and penalties for minimum drug possession, et cetera, et cetera. So yes, some of these things are at a different jurisdiction, but what is Toronto Public Health doing to advocate for that at a broader level to bring more justice to our communities?
Thank you very much for the question, and absolutely agree that this is a central component to the strategy, to the work, and also just to how we work collaboratively to make meaningful change in the space. We know we can't do it alone. That said, we are taking as many steps as we can within our sphere of influence. So that includes sitting at different community partnership tables. So whether we participate in OHT planning, so integrated healthcare service planning at that community level, we're participating at the table there with our provincial counterparts. We also have community-based funding relationships and service agreement relationships with community agencies for distribution of certain supplies. So we support and amplify, and in that way, we absolutely are advocating for increased access to a range of housing supports. We know that's fundamental to making a meaningful impact in this space and advancing justice, as you phrased it. And then also, I would say that Toronto is taking innovative and leadership steps. The TCCS is an incredible program that's, you know, Toronto developed and led. Decriminalization, our Made in Toronto model, reflects the feedback from our community. So we are trying to make those policy changes and influence even beyond our official sphere of responsibility. So in very specific practical ways in terms of service agreements and partnerships at tables with a range of partners. We also work and are a member of TOAN, which is the Toronto Opioid Action Network, which brings together different health system partners, including local hospitals, so to collaborate and to innovate and to support each other and kind of fill those gaps in that service continuum. So in those ways, and also in official formal policy ways, we are trying to influence the conversation, and the strategy is publicly available. I hope our counterparts at the province and the federal government have taken a look at it, because it provides that kind of direction and vision for where we'd all like to go together. Thank you.
Okay, thank you. 3 minutes. William.
Thanks so much, Chair. Thanks so much, Public Health. My question is actually to emphasize on public health, because public health focuses on prevention. And when you look, I was more interested in your one-year plan, looking at education, what I talked about earlier and what Walid has said. I don't know if you have a chance of looking through your one-year plan to make some changes after meeting this committee, because we represent communities which are highly affected by mental health. So therefore, I would want to see some maybe changes in your one-year plan to include strategies that are impacting communities, especially in terms of preventing mental health, the causes of this. Because public health is about prevention. Thank you.
Thank you very much. We'll absolutely take that back and ensure it's incorporated in our annual report back and the actions that we take within Toronto Public Health.
Sorry, go ahead, Shannon. You have 3 minutes.
Hi, my question is just about the stabilization space or spaces. I've seen it and heard you refer to it both singularly and plurally. So I'm curious, is it a space, multiple spaces? How are we determining where either the space or spaces will be? Obviously, in reference to the heat map and a lot of services being already located in the downtown core, just curious how that space is being determined.
Thank you for that question. Through the chair, there is one specific application that's currently in front of the provincial government already for funding, and that would be located at the Gerstein Crisis Center. So there is that one specific service location. And then, of course, we would like to see more across the city. I think the data supports increased access to more of those kinds of services, but we are also specifically talking about this one proposal that's already in front of the provincial government for funding.
What is the sort of campaign around education or letting folks know that that space exists, how they can access it? Is there going to be concurrent services that would help get people to this space? Like, what if we're talking about one space, then how are we making sure folks can access it?
Yeah, that's a great question. Thank you. Once we received funding, or once the Gerstein Center received funding for that space, then we would make sure that there was a detailed implementation plan to support increased awareness and education, and also integration with other service pathways to get there. So I would imagine it would include partnership with other city divisions, and then and a very specific information and implementation plan. Thank you.
Thank you. Queen, you have 3 minutes.
I have two questions regarding the space. Is there a plan for culturally relevant systems of care there? And regarding the decriminalization process with the police, is there a plan to integrate how that will work in regards to the center?
Great. Thank you for your questions. I'll answer the second one first, if that's okay. As part of the proposed approach for decriminalization, which of course we have not yet received approval for, it did include an implementation plan where Toronto Police Services would provide referral connections and services to individuals. So there would be, if we were approved, as part of that implementation plan, there would be a pathway to increase referrals to services. So that, we are hoping to turn it from a criminal issue to a matter of health and increased access to healthcare services, and that referral process would be part of that implementation pathway if we received approval. The first question that you had about the Gerstein proposal, I don't have the details of that proposal in front of me, but I'm happy to share that information back with the committee at a later date.
Thank you. And we will now move on to speakers. Any speakers on this item? Okay, well then I will speak then. Go ahead, Waleed. Go ahead, you have 5 minutes to speak.
Thank you. I just want to thank our friends for this important presentation on the other pandemic that we don't talk about, which is the amount of folks that die in our neighborhoods, and also the importance of addressing stigma related to mental health and abuse of drugs. And I'm hoping that in the future we can make the connections between what public health, the important work that public health is doing in collaboration with other city services. What I worry about is whether data is being shared. I've been to quarterly meetings of various neighborhood police officers. And for example, the amount of the data related to those that die in our neighborhoods is not easily accessible. We don't know about what culturally appropriate interventions look like in very diverse neighborhoods, whether it's Moss Park or St. Jamestown or other neighborhoods like Lawrence Heights. We don't know what referral services exists. And I'm not even confident whether Toronto Police Services or other folks who are there on site on an emergency basis are aware of these programs and interventions. So I would like to see more coordination among city services. I would like to see a table that brings those folks together to focus on this as a critical issue. I'm glad our deputy mayor worked with Taibu, I'm assuming is the proper acronym, on a town hall or an initiative to highlight this issue as a crisis within our city. But I'd like to see more done. I think it's important to, as part of your review, and I see you do have a terms of reference with 6 individuals with lived experiences, which is great. 6 experts from the mental health or substance use sector, which is great. But I'd like to see the leadership of organizations that are doing this culturally appropriate interventions at that table as well. Because I think it's important to get that lens. When I think about stigma, I think the best way to deal with stigma is trust. And that process requires a lot of effort but by those who really care about solutions. And I think it's important to have those folks bring that lens to the meeting so that you folks have the knowledge on how to best address it, especially when it comes to marginalized members of our community that are usually not at the table for these discussions. Lastly, I'm looking forward to an educational campaign. I think it's important for the broader public to be aware of this data and of the interventions that are made through public health and how they could be collaborators in this work. When I saw the statistics about cannabis use or other drugs, the harms, like what is the harm? How does that look like? And how can interventions be made at every level, including our schools, because I think that's pretty important work. So thank you so much for your presentation, and I really look forward to working with all of you. Thank you.
Thank you. Anyone else? Seeing none, okay. I will then speak. I have a motion. You want to put it up on the screen? No, I'll read it out. Reads that the CABER Committee recommend that Toronto Public Health explore additional interventions that address the systemic root causes of mental health and addiction issues outlined in Our Health, Our City plan and identify approaches Toronto Public Health can take to provide additional supports that better support Black, Indigenous, and equity-deserving communities, and report back to the CABER Committee by the second quarter of 2025. So as everyone knows, I am the chair of public health, and I live and breathe this every day. Prior to being a counselor and school trustee, I have 22 years of experience in the addictions and mental health field, the hospital sector. And we know that 75% of addictions and mental health actually happens in people's homes. There's a perception that it happens on the streets, in the parks, but majority of these things actually happen at home. And this is why it's important to actually, spread a wide net, making sure we actually look at this citywide. And I'm really pleased with the work we have done at Public Health thus far, especially when it comes to the one-year priorities for the city, around housing, for example. I know that all hands been on deck when it comes to building not only low affordable housing, but affordable housing. I didn't put my timer on, but affordable housing. As you probably know, that earlier this year, the council actually expanded the crisis service across the city, which is really important. We're working with our hospital partners to make sure that people are taken care of in the right way when it comes to mental health addictions. And even just yesterday with my meeting with Dr. Davila, we talked about a 24/7 crisis stabilization space, and we are actively looking for a space. I have an idea as to where that may be, but I can't share that, of course. But so again, it is very much a priority, and it's important to all of us, and especially we know that Black people, Indigenous people are overrepresented when it comes to mental health and addictions. And we have to make space to make sure that there is a safe space for them to go to, which is culturally appropriate, as mentioned by Walid and a few other people here today. And my commitment to you as chair of this committee and chair of public health is that we are using those equity lens when we are addressing those issues. So any questions about the motion? Saying none. So we'll vote on that. All those in favor? Opposed? Carried? Do I need to also for receipt of this? No? Okay, very good. So we'll head on to item number 2. Find my place. CR 3.2, and thank you to Public Health for coming in today. Item CR 3.2, Toronto Community Crisis Service Program. So a number of members had requested a presentation on the service. This helps us advance our priorities around mental health as well as around intersections in the criminal justice system, with one of the CABR priorities focused on increasing transformative justice programs. I understand this work also saw its roots in the CABR Action Plan, with actions focused on identifying alternatives to policing. So Nicole Watson, Manager Policing Reform, and Mohammed Shari, Director Community Safety and Wellbeing, Social Development, Finance and Administration, are here to give a presentation to the committee. So go ahead.
Thank you, Chair. It's a pleasure to be here before this committee to share with you about the Toronto Community Crisis Service. We'll just give the technology a second to get going. You heard from our colleagues from Toronto Public Health identifying this as one of the key action items as part of the broader mental health and addiction strategy. And we'll share with you at a high level the approval the City Council gave for the expansion of the Toronto Community Crisis Service and the intention for the service to be made available citywide before the end of this year. I just want to begin by situating the crisis service within the city's broader community safety wellbeing plan. Community safety wellbeing plans are a requirement by the provincial government for all municipalities and jurisdictions to have a plan. We adopted our plan in July 2021, and this is one action item under our plan, specifically Action 1.3, which is to build out a well-resourced crisis service available across the city, and we are working towards that specific action plan this year. The next slide is what you just had the presentation on. This is one action item within the broader city's mental health, substance use, and harm reduction and treatment strategy of the city. So I won't dwell too long on this, but to reiterate that it's a key priority in year 1. Before I get into how we got starting this work in 2020, I just want to begin by situating, as the chair highlighted, this really comes out of the Confronting Anti-Black Racism 5-year action plan, specifically Action 16, that calls for a broader rethinking and re-examination of policing approaches and to engage community and develop an alternative safety models. And then we saw in June of 2020 with the murder of George Floyd, the racial justice protests across North America and calls for reimagining crisis response. City Council adopted 36 recommendations as part of policing reform. One bucket of those recommendations was the need to look at alternative community safety responses and to reimagine a non-police model for mental health crisis response that it was client-centered, trauma-informed, and reduces harm. In our review at that time, we did a jurisdictional analysis. We did extensive community consultations, which we will share shortly. But it was very evident that clearly underinvestment in our mental health system over decades have led to the police, our mental health sector, as well as our community sector, has led to many people not receiving supports that they need and fallen into distress, and that the police were becoming the front line of our mental health system, which was not appropriate. We saw that calls for person in crisis and addictions supports had increased by almost 42% over a decade at Toronto Police Services. And we know addressing health issues through a law enforcement lens creates service barriers and risks, particularly for Indigenous, Black, and equity-deserving communities. Just as an example, you take a look at the 1988 incident with Lester Donaldson, a Black Toronto resident who was killed with a police interaction during a mental health crisis call. Fast forward with Andrew Loku, these incidents happen over and over again, and community has called for us to reimagine and to think of a safer, healthier way to respond to these calls. So with that, we did extensive community consultations in the fall of 2020. It was early times in the pandemic, so a lot of it was virtual, but some of it was in person. We did a community survey that had 6,384 respondents. We also commissioned a public poll that oversampled Torontonians of Indigenous and Black communities to ensure that we were able to hear directly from communities some of the challenges that they were having with access to mental health supports and broader supports, but also their desires for what reimagine a crisis response can look like. We engaged 33 community roundtables organized with our 17 community partners. We specifically partnered with Black-led, Black-serving, and Black-mandated community partners such as Black CAP, Taibu, Black Health Alliance, and across boundaries to facilitate these conversations. And we also engaged 29 key subject matter experts ranging from various different fields, including public health, law, academics, activists, and frontline workers to engage their thoughts on what was needed. We also had an ongoing community advisory table, accountability table that was composed of community organizations, some of the ones I've already mentioned that help facilitate our community engagement, including the Black Legal Action Center that participated in our accountability table to inform our actions. So we fast forward, we presented a pathway towards a pilot to City Council in February of 2021 that was adopted. And we also presented key guiding principles that were informed by the extensive community consultations. Number one, we heard clearly that there had to be multiple coordinated pathways to access the service. There cannot necessarily be one door. So there had to be multiple ways for people to access the service, and we'll talk a little bit more about what that looks like. Number two, there had to be harm reduction principles and trauma-informed approaches incorporated in all aspects of the crisis response, both from the staff training, service delivery, and also the approach. Number three, the model had to be transparent and consent-based model of crisis response, and we'll talk a little bit more about what that means. The service, number four, had to be client-centric, culturally relevant, and allowed for individual supports needs. And we heard this clearly through particularly community surveys of the Black community, that there needed to be culturally relevant supports available, and we'll talk about what those services are. And last but not least, there had to be accountability to the service users' voices and feedback, establishing clear pathways for complaints, issues, and data transparency, and we'll talk more about that. So these are the core principles that inform the development of the Toronto Community Crisis Service. So what is the service and what did we pilot? City Council adopted piloting a service in 4 specific areas of our city, and the service, the Toronto Community Crisis Service, would be a 24/7 service, so ensuring that the crisis response service was available to all residents at any time that they needed to access it in those pilot areas. That it was voluntary and consent-based, meaning the service has no ability to detain an individual. If that was required under the Mental Health Act, the service would have to request engagement with Toronto Police Services. The service serves clients who are above the ages of 16. The service is trauma-informed and harm reduction, which is one of the key principles. And then in terms of accessing the service, residents can reach the service by calling 211, which is an alternative service door. It's run by an organization called Find Help Toronto, and it provides access to 60,000 different programs and services. Roughly 4% of our calls are just handled on the phone, and people are able to get referrals to supports that they need over the phone, and there's no need for a mobile response. The mobile crisis teams, this is really the core of the service. 2 trained mental health clinicians arrive and meet the individual wherever they are, if they are in public spaces or at their residence, to provide any supports they might need. And our response time is under an hour. I believe it's actually 25 minutes. Yeah, I knew it was under an hour, but 25 minutes is even better. And post-crisis response, we provide follow-up and support for up to 90 days if somebody wanted post-crisis supports and follow-up. But we also follow up within 48 hours after the call to see how the individual is getting on and what supports they needed. And last but not least, connection to culturally relevant services. So each of the partners, you'll see that the city, and I neglected to mention this, the city has partnered with 5 amazing organizations to deliver the service. So it's not the city staff that are delivering the service. We are working with a community-based partners to deliver the service. The partners that we've delivered, are partnering with the service to deliver it, are providing referral pathways that involves other community-based agencies and services, and we'll talk a little bit more about what they are. So the city's role is really to serve as backbone support, provide funding and oversight and administration, but also to do the necessary intergovernmental advocacy in terms of what was identified earlier by my colleagues from Toronto Public Health in terms of need for, let's say, a 24/7 crisis center, or broader changes like that, do public education campaigns, and then identify areas for increased community investment. On the right-hand side, you'll see under anchor agencies that our service is delivered by a health service provider. So we have 4 that we have partnered with who are funded to hire and manage the mobile crisis teams, as well as to provide the wraparound supports and case management. We have a community advisory table that helps support and guide the service at each pilot area, but also across the city. And one of your colleagues, Halim Ohashi, is part of the community advisory table. We have the crisis teams are multidisciplinary, so they have different backgrounds, and they respond to all calls at a minimum of 2 of them for each call to ensure mutual safety. And we've partnered with the Provincial System Support Program at CAMH to provide a regular evaluation and continuous improvement recommendations as we were implementing in the pilot phases, and have published a 1-year evaluation report in November that's publicly available. Last but not least, our access and intake partner. As I said, residents can reach the service if they call 211 and if they're in the appropriate pilot areas while we work towards citywide expansion. And any calls made to 911 that meet the criteria will be diverted for a mobile crisis response team by the team. So who are our partners that I talked about? These are our 4 partners that manage the mobile crisis teams. Find Help 211 is our dispatch partner who takes the calls. But in the Northwest, we have the Canadian Mental Health Association, which provides anti-racist, anti-oppressive, and culturally safe approach in terms of their mandate as their mobile team. We have Taibu Community Health Center, and I know you'll hear shortly from them about the great work that they do, which provides an Afrocentric approach to mental health and well-being. We partnered with Two-Spirit People of the First Nations, which is providing our Indigenous-led approach with a focus on harm reduction and holistic health and wellness. And last but not least, we have Gerstein Crisis Center, which has been running for over 30 years, their own mobile crisis team, and is specifically a strengths-based, non-medical, and trauma-informed organization. So these 4 partners manage the mobile teams and the wraparound supports. So you'll see in this map the 4 areas that we decided to intentionally pilot. The pilot was launched in March of 2022. And in these 4 areas, we decided to pilot with the partners, as I mentioned, in the Northwest, Canadian Mental Health Association, in the Northeast, Taibu, the downtown core, Gerstein, and then in the downtown West, Two-Spirit People of First Nations. You might be wondering, why did we pick these 4 areas? We picked these 4 areas based on Toronto Police Services data on calls for service and mental and substance use calls. We also looked at mental health apprehensions. We also looked at community social services availability. And we also looked at key populations that we're trying to prioritize: Black, Indigenous, and equity-serving communities. So we've intentionally anchored the service in the Northwest and the Northeast to ensure areas with large Black populations were being served immediately, as well as ensured that the service was available in the downtown core, where there is tremendous calls for service around person in crisis and substance use. Good news is Council did approve fully expanding this, and we're moving towards that by the end of this year. My colleague Nicole will talk about the new expansion and walk you through the next few slides.
Thank you very much, Mo. So, as Mo mentioned, before the end of this year, the service will be expanding citywide. We will have a very robust public awareness and education campaign that follows that expansion. What you see now on the screen, though, is the new boundaries or borders for the expanded Toronto Community Crisis service areas. So, as you'll see on this screen, Gerstein Crisis Center will be serving Central Toronto and South Etobicoke. That's the lightest green. We have CMHA Toronto, which will be serving North Etobicoke and North York. That's the darkest green color on the map. And then Taibu will be servicing all of Scarborough. You'll also see a dotted border around the map. That is to represent Two-Spirited People of the First Nations, our Indigenous specific response, which will be moving to citywide service. This is a high-level service map just to sort of outline what happens when a call comes in to the Toronto Community Crisis Service. So the call may come through 211 or 911, which is represented there on the screen as the crisis piece. As it comes in, it's accessed and triaged for mobile response. We have an MOU with Toronto Police Service that outlines the call types and criteria for diversion to the Toronto Community Crisis Service. There are 6 different call categories that fall within that. That's calls that are categorized as thoughts of suicide, person in crisis, well-being checks, distress or distressing behavior, disputes, and advise. So once the call is assessed and a mobile team is dispatched to the scene, the teams will arrive and provide on-scene support to the service user. This could include crisis de-escalation, but it also includes supports that address the social determinants of health for the service user. So it could be things like providing food, water, clothing items, blankets, and other care items. After the teams have met with the clients, there is the aspect of follow-up supports. So within 48 hours, the service user will receive a follow-up from the crisis teams. They will also be engaged in up to 90 days of case management support if they choose to be. And this is also the point where we have the wraparound supports and the networks of partners that also come into play to help with case management and follow-up pieces. We do have a number of Black-led, Black-serving, and Black-mandated organizations that are part of the networks of support. That includes CAF-CAN, Black Creek, Black Health Alliance, Parkdale Queen West CHC, Regent Park CHC, Rexdale CHC, Jane and Finch Center, Yorktown Family Services, and that's just to name a few. There are others as well. In terms of some of the early outcomes, so we did bring forward our year 1 evaluation to council in November of 2023. This slide highlights some of the high-level outcomes from our first year evaluation. So as you'll see on the screen, the service received 6,827 calls for service over the first year. Of that, 5,868 were dispatched for mobile response. You'll also note that initially, we had more calls coming through 911, so 55%, as opposed to 211, which was 46%, although these numbers are very close. Just want to provide the update that since this point in time, we are seeing now that 211 has become the main pathway for service access. This very much aligns with what we heard through the community engagement that Mo spoke about previously in terms of community members, particularly those from Black, Indigenous, and equity-deserving communities, wanting to be able to reach the service through a door that didn't involve a police engagement or police enforcement lens. In terms of our diversion rate, so you'll see at the top right, 78% of the calls over the first year were able to be handled by the Toronto Community Crisis Service without police involvement. And of that, only 8% resulted in hospital emergency department visits, and in only 4% of cases did calls require any other engagement from emergency services, namely Toronto paramedics and Toronto Police Service. Some additional outcomes in terms of support to community members or to service users. In the first year, over 2,000 supports or referrals were made on site for follow-up visits for service users. 56% of service users also agreed to be engaged in our follow-up wraparound post-crisis management supports. Of those, 300 culturally relevant supports were provided to service users. And of that, 50% were for Indigenous-specific supports, such as access to ceremony, traditional medicine, and family and kinship care. And we had 20% that were for Afrocentric, West Indian, and Caribbean-centric supports. This included things like access to Black physicians, access to culturally relevant food, referrals to cultural programming, and other resources. We also noted that in that first year evaluation, 29% of the service users surveyed identified as Black. And we will be looking to focus in on service user engagement and outcomes in our year 2 evaluation that is taking place at this time. We also, as part of our year 1, developed the Strengthening Community Crisis System grant. And 2 of our grantee organizations through this grant are Black-serving organizations. One is Fred Victor, and specifically their mental health and crisis response for African, Black, and Caribbean communities program. And this provides enhanced capacity and access to Black mental health physicians and mental health care and addictions case management. Toronto Community Crisis Service service users are able to access this as priority clients, and so they have faster access to being able to receive those culturally relevant supports. We also funded Parkdale Community Food Bank for their Enriching Foods program. So this is to enhance access to culturally relevant foods that might be proteins or spices, and also encouraging or additional engagement outreach efforts with the Black community to support access to food and health. In terms of some of the early feedback we received around the service from service users, we did hear that 95% of service users reported being satisfied or very satisfied with the service they received. 90% said that their interaction had increased their feelings of safety and well-being. And in terms of connecting people to the supports they want, 95% of service users indicated that they were able to decide the supports they needed and felt emotionally safe in receiving those supports. I just wanted to mention here as well that there is a training program that accompanies the Toronto Community Crisis Service, so all crisis workers who are engaged in the mobile teams go through the training program. This year it's over 200 hours of training and 8 weeks over an 8-week period. And we did focus on certain trainings that highlight the needs of Black, Indigenous, and equity-deserving communities. Some of those training topics include centering Black experiences, Afro-Caribbean Black harm reduction practices, Black and Indigenous approaches to wellness, African Caribbean Black communities, and Canadian law, which looks at the role of the law in sustaining and creating some anti-Black racism concerns. We also had a number that focused on intersectional approaches, so intersectionality in mental health care, supporting families in crisis, working with undocumented Torontonians and newcomers, and responding to disclosures of gender-based violence. In terms of some of the early feedback and quotes from service users, you'll see 3 on the screen, and I'll just read a couple. So the first service user noted, "They helped me understand that I'm worthy, and they wanted to see me go forward. They uplifted me and made me feel like I'm worthy. It is just such a feeling of comfort, and with that, the element of safety is present, knowing that the service is there and that it is safe," said another service user. In terms of some additional resources, so our 1-year outcomes evaluation report is available online, along with all of our council reports that have taken place. We are also working right now on updating the Toronto Community Crisis Service website on the city's website, and we'll align that with the forthcoming expansion. I'll just pass it back over to Mo to conclude.
Thank you, Nicole. And I think we wanted just to pose a question to you, because I'm sure you got lots of questions for us, but our question for you is, as we work towards the expansion, what are some key considerations for public awareness and education that we should be mindful of? So any feedback you have, because we are planning our public awareness campaign now. Thank you.
Thank you, Mohammed and Nicole. Questions? Go ahead, Efka.
Yeah. Okay. So first of all, thank you for your presentation. I do want to commend you. The community organization that I do work for, some of the outreach workers did come over and let us know kind of the services that they provide and things like that. So that was great to see. So I am aware of this program previous to this. And I think that's what's important as well. The outreach to the local community groups does work. It is effective. We did have pamphlets and things that we could hand out to our clients as well. And then also with signage and things like that at the local bus stops, and having people attend community events that the local community organizations put on. And also looking as young as even the youth and their community fairs. I know especially this month and next month with school ending, they're doing their fairs. And it would be great to have like a presence there for you to let them, the youth know, because they're also suffering and may have mental health crises as well. And then sometimes, or most times, their parents are also present, so that also gives you access to them as well. So yeah, thank you for the work that you guys are doing.
Thank you.
It's pronounced Afia, right? Afia, yeah. Okay, thanks. Any other questions? Go ahead, Lucina.
I actually just have a quick question regarding the diversion, the screening process for diversion. Could you just tell us a little bit more about how calls coming in through TPS are then diverted to your GREAT program? Are those calls, are there particular criteria that dispatchers are trained on to pay attention to? So who is essentially involved in that decision-making for diversion?
Thank you. So I can start, and Nicole can add to it. And through the chair, we have a memorandum of understanding with Toronto Police Services where we've outlined the call types that would be appropriate. So any call that is mental health, has a mental health component, and that the criteria really is just only 2 tests, that there's no immediate public safety need in terms of the individual or others, and that there's no immediate medical distress that the person is in terms of requiring paramedic services or others. If those 2 things are ruled out, depending on if the individual also consents to the service, the call is then diverted to the Toronto Community Crisis Service through Find Help 201, where the call taker will review the details of what's going on, where they are, and then dispatch the team to respond. One thing that we are working as a process improvement is to remove the consent. Because we've realized that it is a bit of a barrier for people who do not know about the service, that the 911 call taker has to take a significant amount of time explaining the service to them, and we're working with Toronto Police Services to ensure that calls that do meet the criteria are immediately diverted over to the crisis teams to respond to. I will also just add in the training component. We've gone and worked with Toronto Police Services to deliver training to the 911 call takers to understand what the service is about, how it works, and why it's important to divert. One thing we heard from them is after we divert, we don't hear about what happens. Was it successful? Was it not successful? So that was great feedback. So because of that, we've been sharing with them success stories of, hey, here's a call you diverted. Here's what the teams did when they arrived. Here's how this individual is supported and connected to supports, which has only provided further trust and confidence with the 911 call takers. So that's some of the initiatives we've been taking. My colleague Nicole might have others to add.
That's good.
Okay, that was concise, I guess.
Okay. Wally, go ahead.
Thank you, Chair. Great work, Mohammed and Nicole. Thank you. Thank you so much. I'm a big fan of this service. Actually, when I used to work with West Neighborhood House, one of my main responsibilities was to ensure the expansion of the service across the city of Toronto. So I'm so glad that this outcome has finally been achieved. I have 3 points that I was hoping to raise with both of you. First, when it comes to your own data, some of the folks that could benefit from this service are 16 years old, right? The service is open for 16 and above. How are you working with Toronto District School Board to ensure that this service is promoted and utilized as one of the interventions? I know one of the biggest campaigns we ran as a community was to remove police officers from schools through the School Resource Officers Program. So how do we supplement that piece, replace that piece with crisis workers? So that's the first question. Second question, it relates to hiring. You can't address mental health, you can't put forward interventions that are culturally appropriate if you're not hiring folks from those communities. So I'd like to have a better sense of what your hiring practices are. How are you engaging with social workers or folks who are doing this work in the community? I call them community gems, heroes, the folks who do the interventions without anyone asking and they're not getting paid. So how is that happening? And then third, my third question relates to accountability. And I'm glad that you, in the previous question, you answered that by talking about how you're being accountable to the 911 operators about the impact of this service. How are you being accountable to the community? Not to just city council, but how are you reporting back to the community on the outcomes of the Toronto Community Crisis Service so that you can identify gaps, so that you could build relationships with folks in our community, so it could work more cohesively. I'm really glad to hear that you're working with the community health centers, like the Regent Park Community Health Center and others across the city. I think those are anchor agencies that are critical in this work. But are you working who are the unusual suspects you're working with? Are you working with neighborhood associations? Are you working with, other important advocacy organizations within our city? So I want to hear more about that. Thank you.
Through the chair, I can start out. In terms of some of the outreach to the sort of youth population 16 plus, through our community anchor partners, they do regular outreach at local high schools in areas where youth may frequent, so also Toronto Public Library, and they also have done outreach to counselors within the schools to be able to make sure they're aware that TCCS is a support that is available. We also do have partnerships with youth-serving organizations through the network of partners, including SAPACY, the CAMH Substance Abuse Program for African, Canadian, and Caribbean youth. So there are those sort of outreach points. I do think it's an area that we are also looking to further enhance and explore. So that is something that we have top of mind as we move towards the expansion. In terms of the second question around hiring, all of our anchor partners are hiring with the representation of community in mind, and also centering the importance and expertise that come with lived experience from those communities. We, on the city side, did help by organizing a recruitment and hiring event with our partners in March, where we saw a really good turnout from a lot of people of diverse backgrounds from across the city. This is an area that we're continuing to monitor as we go forward, and actually working with our anchor partners to track in a little bit more detail. So we may have more metrics around that over the next year or so. But both really excellent questions, and I'll just pass it to Mo for the third point.
Thank you, and through the chair, thank you for the question. I think I love the terminology is community gems, and we're trying to leverage community gems through, we have local advisory tables for each of the pilot areas, and right now, as we transition from 4 pilot areas to citywide, we're going to be expanding those advisory tables to have more community representation to provide that accountability. We also have a citywide accountability table that has both people with lived experience, community advocates, and community stakeholders that are part of it, as well as system players such as Ontario Health and others who are part of our table to help inform the regular service. The other thing is also you talked about what are some groups that we've done outreach that is sort of not really usually thought about, and one group is actually faith-based groups. The great partnership at Taibu Community Health Center has engaged faith-based groups to help raise awareness about the services and availability. We know, particularly, I'll speak on behalf of the Muslim community, that oftentimes people really go to the mosque for direction on engagement and for supports, and that's the same in terms of churches and other faith-based organizations. So we're working through that as well to raise awareness, and we're open to any suggestions that you may have.
Thank you. Amanayer, 5 minutes.
Oh, okay, thank you so much, guys. I'm very impressed with your work. I have only 2 questions. One is on the 78% of transferred calls from 911 that are handled without police intervention. That sounds very great, because my understanding is that police is one of the escalators of mental health. But at what point do you require police intervention in these calls? The other question is on trauma-informed care, which is very great. It's a very great piece of managing mental health, because many people use drugs because of trauma. How are you ensuring this, and how are you doing it? I just wanted to learn from that. Thank you.
Sorry, can you, through the chair, can you just repeat the second question? I missed the second question. My apologies.
I was talking about trauma-informed care, trauma-informed services in terms of mental health, and I'm saying it's a very important piece in managing mental health. How are you doing this?
Thank you. So I'll start with the first one, and you can do the trauma-informed care one. In terms of the police interaction and when are police required on our calls, the service is a consent-based service, so if there is a need for the individual to have be transported to the hospital and they are not consenting to be transported to a hospital and they need assessment. So under the only Toronto Police Services can exercise the Mental Health Act. So if the team requires that, they will engage Toronto Police Services to attend, or if this team identifies any potential safety issues, or if the team are not able to gain access to the property. Because if we might get a wellness check where a family member is worried about somebody, the team has no right of entry to a private space. So if they require a right of entry, they will seek police engagement. As highlighted, less than 4% of our calls required police and or paramedic engagement. Roughly 2.5% of our calls required paramedic engagement, and 1.7% of our calls required police engagement. And I think out of 5,000 calls, maybe fire was at one call. So Toronto Fire Services is not usually engaged, but they are taking on an increasing number of calls. In terms of the trauma-informed care, I'll let my colleague Nicole talk about that, because that's really embedded in the training provided to the crisis workers, as well as the overall philosophical approach of all our partners.
Yeah, through the chair, and thank you very much for the question specific to trauma-informed care. We heard that that was a really essential piece for the service. So as Mo mentioned, we have integrated that through all aspects. And in the training program in particular, every trainee, every facilitator who's part of that program is approaching the material that they're delivering from that perspective. We also have several sessions that are specific to providing trauma-informed care to diverse communities. This even relates over to documentation practices and how do you ensure that as you are documenting, that is also through a trauma-informed lens. So it is throughout all of the work that we have been engaged in for the service. I also think it's an area that we continue to want to reinforce and strengthen, so always open to ideas or additional ways to be able to do that.
Okay. Thank you.
Okay, great, thank you. So I did want to ask, just to clarify, so given a situation where a call is made and maybe the initial situation doesn't require police presence, it could escalate. I mean, if the job is done well, I wouldn't say well, if the situation doesn't escalate, then hopefully no police is needed. But in the odd case, as you guys have mentioned through your statistics, that does happen. Are police around the area in anticipation, or are they later on called, or what happens in those situations?
Thank you for that question. And through the chair, as you pointed out, these calls can be dynamic. And so the team, I think it's important to first begin with their training, are trained to respond in pairs, or provide community safety training in terms of how they enter a space, what are the entrance, the exits. If they were having a conversation with the individual in the kitchen, to try and move the conversation over to the living room or another place. So that's part of our training as we build up the capacity of the crisis workers. We also do scenario-based training where we actually reenact situations, and we, through an engagement with a professor from the University of Toronto who trains Toronto Police Services, have built a curriculum where we train our crisis workers to respond to scenarios and then provide feedback and coach them. But specifically to your question, if the teams require police services, they're able to reach out to Toronto Police Services and they will respond immediately as the team is required. They're not stationed in and around the call. They respond to these calls on their own, and then if they require police services, part of the training is, if the situation is unsafe in that space, to retreat to their vehicle and wait for police to arrive and or paramedic services, or meet police services at the property if that's required.
Okay, and then what about in the case where the situation has started off as violent or potential safety risk, and the police do respond, but it's quite clear that it's a mental health issue? Are the police then required to neutralize the threat at that time and then send that person to the hospital at that point? Or would you guys kind of intercept that, and once the threat is actually taken care of, then you can do the work that you guys do?
So Thank you for the question. So through the chair, in a situation where the call is escalated and police is required or they're already on scene, we've had many calls where the teams have co-responded with the police. So we've done training with police services when we rolled out the service to say, hey, here's this new service, here's what it can provide, here's what value it adds, and we will be on some scenes with you, and the goal is to respond together. So police services have been open to that. There are certain situations where they may first need to secure the property or the situation, and so they have scene control under legislative authority to do that, but the teams will then, after the scene control, if the individual is apprehended under the Mental Health Act and is going to the hospital, ask to accompany the person and then go to the hospital and advocate for the individual and then try and provide follow-up support to the individual. So we try as best as possible to co-respond with police services if that's possible.
So it's really up to the officer's discretion whether or not to have you guys kind of participate in that and co-respond, right? Because,
well, legally, the police have control of the scene.
right.
So
Okay. So it's up to them to decide if they want to.
we've worked with police services to provide training that we are there to be a value add.
Okay.
Yeah.
Okay, cool.
Thank you. Any further questions? Anyone? Go ahead. Kathy, go ahead. 5 minutes.
Thank you. I have a question, a comment and a question. So thank you for the work that you're doing and for this presentation as well. Some of the gaps in which I noticed in the previous presenter's presentation in terms of areas of service, I see that you are addressing that. It's not clear to what extent that sort of either race-based data has been collected in order to, by the Toronto Public Health in order to determine where services are most needed. So I do appreciate in making certain that something is done right now, that you've already taken care of looking at areas which are covered right now by Taibu Community Health Center and Canadian Mental Health Service in the Northwest. I'm wondering who are your crisis workers? And this is a huge area to cover. And so I don't know to what extent that if somebody calls 211, is there someone who can actually attend to this situation? You've mentioned that usually you try and get there within 25 minutes, which is wonderful to hear. Although obviously a crisis requires getting there sooner even. Originally you thought an hour, but 25 minutes is great, but 5 or 10 minutes is better, if possible. So I don't know to what extent that resources are needed in order to expand that service for individuals. And then similarly, if you could describe a little bit further about, let's say you're making referrals to Taibu Community Health Center. This is a huge region that they're covering for just one center. And so how is that done? And then lastly, I guess in terms of accountability, I know that you showed sort of a mini satisfaction survey, but are we collecting, again, some only reason I think in collecting race-based data is in order to measure racism and accountability for that. So to what extent are you using that data, collecting that data and using it for that purpose? Thank you.
I can start. Maybe we'll start with the last question around the extent of collection of race-based data and how that's used to inform the program. The short answer is we do collect race-based data, particularly from our clients who are on case management, and that's how the figure of 29% of clients who are on case management identify as Black comes from. And we use that data to also, we have the satisfaction data broken down by clients who identify as Black and Indigenous, and it's roughly 90%. It stays at around the same number. It's part of our first year evaluation report provided by PSSP, and we can certainly share that with the members of the committee. In terms of the referrals, I could maybe also touch on that one. You're right, the surface area is quite large for Taibu, but also for the other partners, but they do have a network of partners they're able to refer. So it really depends on the needs of the individual. If the individual's needs are around primary care, Taibu being a community health center, and I know Phil is here, but they can provide that support. But if they need to provide access to other supports. They can refer out to the Scarborough Centre for Healthy Communities as an example, or if the individual is a youth member and could benefit from access to SAPACY, they would provide. So it kind of really depends case by case the individual's needs, and they're able to necessarily refer out. They also have partnerships with specific community-based mental health agencies such as Hung Fook, which we know with a large East Asian community population in Scarborough. They're able to also refer out to those agencies to provide supports as well. In terms of the ability for the mobile team to respond to calls over a broad area, we currently have 6 mobile teams active in our 4 pilot areas. We're going to be expanding that to 12 vehicles in the expansion. You are right, in a moment of crisis, maybe 25 minutes does feel too long, but it's important to highlight that these crises aren't necessarily a crisis involving a possible threat to life. This is an individual who's going through a mental health crisis, and the immediate need in terms of any potential threat to life would be escalated for a response by either paramedics or police services. We are monitoring our response rate of 25 minutes, and through our community conversations, our surveys, if we need to improve that service standard, we're going to work towards improving that service standard. And to your last question about who are our crisis workers, I'll let my colleague Nicole share a little bit about who they are.
Through the chair. So in terms of who are the crisis workers that are part of this, they're really a diverse group of individuals with varying backgrounds and experiences. Some of them are from the social work field. We have had nurses in the past. Many are from a counseling background. One of the exciting pieces with the expansion and the public awareness campaign is actually moving to highlight some of these staff that are engaged in the service so that they become familiar, friendly faces, and people in their moment of need will feel more comfortable reaching out and will also potentially see themselves, their friends and family members reflected in the individuals who are, delivering the service. So that's a piece to come. I just wanted to add one thing in terms of the response times and our expanded areas. Many of the partners are looking to co-locate with other services who are part of their networks with the service expansion, and so that will also help in terms of breadth across the city and being able to respond to calls in a timely manner, given that they drive vehicles that aren't fitted with emergency sirens and that sort of thing, and Toronto traffic can be difficult. So the co-location piece, that is our hope that will also help keep response times down with the expansion.
Okay, thank you. We're at time. Queen, go ahead. You have 5 minutes.
Thank you for your question, Kathy. We're always in sync. I was going to ask something similar. So I guess I'll ask my other question regarding data. So I was thinking about how you were talking about how the calls go through, and 911 and police kind of work in sync to decide if this program is dispatched. I was wondering, is there data collected on each call regarding mental health and addictions, the process for it, and whether or not this program is called to be a participant in the call when it comes to 911 or 211?
Thank you for that question. And through the chair, 911 is one of the doors. There's also 211, which is another door that has no involvement from Toronto Police Services. There's still a review by the call taker to see if the call is appropriate. But specifically to answer your question about calls that come in through 911, we do have a regular call diversion meeting with Toronto Police Services where we review the data of calls that are coming in and discuss if there were opportunities for diversion in calls that should have been diverted but were not diverted. So we have that meeting regularly once a month with Toronto Police Services and our community partners, as well as Find Help 211. And Toronto Police Services has been open to continuous improvement to identify ways that they could train their call takers to divert as many calls as possible. One of the suggestions that they offered was this idea of removing consent requirements, and that's something that we are moving towards in terms of removing consent from requiring the caller to give consent before the service is offered.
Thank you.
Thank you. I actually do have one question. So you've referred in your presentation, and again, to questions being asked around 211 and 911, but you have not mentioned 988. So is that also a number that's available?
Yes, so 988 is another door that's available, specifically the Gerstein Crisis Center. I'll let you take this.
So through the chair, yes, 988 is one of the pathways that is open to the public in terms of referral to the TCCS. Gerstein Crisis Center is one of their local partners in that, and they receive calls. We are still in conversation with 988 around how that could be enhanced, and they're still relatively new and working through a stabilization effort on their end, so more on that to come, but it is an optional pathway. There is also the distress centers of Greater Toronto that feed in through a backdoor pilot with 211 for service access, so we are trying to build those other access pathways out through those call lines.
Okay. And I think it's really important that you explain to people very succinctly that the onus is not up to the individual as to decide which number to call. They can use any of those pathways, 211, 988, 911, and it's up to the dispatcher to decide, how it's redirected. So just elaborate on those points, because I don't want the public to think that they have to sort of pause and think about it.
Sure. So thank you for the question, Chair. And yes, the individual, as part of our key principle of enable multiple pathways to care, can walk through any door, be it 911, 211, and now 988, and even directly call in the anchor partner. Gerstein Crisis Center has their own line. And so the goal is to, on the back end, sort out if the call meets the criteria and then deploy the mobile team to respond to the individual. So the public, for the purposes of reaching the service, we've been communicating and encouraging the public to call 211 as our primary door, but the public can access the service by calling 988. We do discourage calling 911, given that it's intentionally meant to be an emergency line, and we're trying to shift calls away. And the data has highlighted that shift is working, because most of our calls are now coming through 211. And then we are starting to see some calls come in through 988, as well as the distress centers. But in summary, the public can reach the service through any door they walk through. On the back end, we will sort out the appropriate response for the individual.
Thank you for the clarification. Do you want to have a second round, or should we go to the next? Oh, sorry. Rosemary, you had a question?
I had a very simple, easy question to ask. I just wanted to initially thank you so much for what you're doing and for the wonderful report you presented. But as you were speaking, I wondered, when you were offering the reality that you were intervening with the police and providing training, at what point was that happening? Was that happening with Toronto Police Services, or was it happening at the Toronto Police College? Because obviously the earlier particular interventions can be made, the more helpful they are for the community.
Thank you for that question. And so through the chair, we work with Toronto Police Services to do training at their college about the Toronto Community Crisis Service. Separate from that, the Toronto Police Service does their own training around mental health and how to respond to mental health calls and addiction calls. But we did a specific training on what the crisis service is intended to do, how to co-respond, and the benefits of having trained mental health clinicians respond with police. Separate from that, we also worked with each police division in the areas where the pilot was launched to meet with those officers and to go to what are called parades, which are all staff meetings that happen, and to walk through with them about the service and how they may interact with the service, and then have our community partners also join us for those parades, so that the officers in that neighborhood got to know the teams that will be operating in their areas, and they regularly have check-ins and meetings to check in on particular responses that occurred between the two teams, trends that they were noticing, and areas for further collaboration.
Okay, thank you. A quick second round, 3 minutes max. Go ahead, Walid.
Thank you. This is going to help me answer your question later on. The first thing, in the map of service, there was reference to city ward, so I was hoping you could speak to that. I know, and in Spadina, Fort York, in that coverage. The question I have is with regards to mutual accountability. How do users and stakeholders provide feedback on the service annually? How is this service accessible to newcomers? Potentially new Canadians who might not know about this service. And then lastly, when it comes to your outreach campaign, have you considered promoting this service online over social media, ads on YouTube, Google, in those spaces? Because I feel many folks who are, go through depression shut out of spaces where they interact with other people and are more online. So how are we getting to that population online when it comes to this, accessing this service? Thank you.
Through the chair, I can start, and then Mo, feel free to add in as well. On the topic of mutual accountability, so we do have the citywide advisory table that meets on a quarterly basis, and that is one accountability mechanism that's ongoing for us. There's also the input through the community advisories on the ground at each of the anchor organizations and the ongoing feedback from them. That is also funneled up to the citywide table through representation from certain members who sit on both committees. We also do ongoing feedback through the crisis workers themselves. So we have a community of practice that runs, but we also engage them on what areas in terms of training and topics have they had to engage with that they needed or would like additional knowledge and training on, and then we integrate that into the service components, and that comes out through service delivery. So there's a number of mechanisms around that. Mo may have additional to add. In terms of outreach to newcomer communities, we know that's a very important aspect of the work. Toronto Newcomer Day is happening next week, May 23rd, and 211 will be present with a booth, and we'll also be sharing about the Toronto Community Crisis Service during that event. So that's a really essential outreach mechanism. On the ground, the organizations also outreach to other service providers in the area, including settlement service providers who are engaging with newcomers to drop off materials and make sure that they know of TCCS as an option. In terms of social media, yes, we're looking at that and engaging more on social media through the upcoming public awareness campaign. And that will include both the typical social media channels, but also an understanding of multilingual opportunities and through both online and in print. So we are looking at what are the top languages we want to be translating all materials to make sure that we have that breadth and reach the communities that really do require the service.
Okay, thank you. Any further questions from anyone? Okay, seeing none. Speakers? Okay, seeing no speakers. Thank you again for the work that you do. It's much appreciated, and keep us in the loop. Thank you. Actually, I do need someone to, sorry. Rosemary, you want to move this item for receipt? You want to move this item for receipt? Yes. Okay, all those in favor for receipt? Opposed? Carried. Thank you. The next item is item number 3. Community mental health programs and initiatives for Black communities. So we heard about the broader programs from the city, but I think it's critical to understand how community partners on the ground are implementing the service, especially from a partner who is leading the Black-informed mental health approach. We also have the opportunity to hear about the broader suite of mental health initiatives and programs being provided by Taibu, which is Toronto's only Black mandated CHC. So the Manager Community Services and System Change of Taibu Community Health Center is here to give a presentation. So you may go ahead. Phil Johnson. That's you, right? Okay. Thank you for being here today. So just while you're setting up, I just wanted the committee know that I do have to leave here at 12:30. So Lucinda will take over if the meeting goes beyond. that. You lost me. Can the members online please turn on the cameras just for quorum purposes? Thank you so much. Okay, you may proceed. Need one more member to turn the cameras on so we know that you're here for quorum purposes. Okay, we have two. Okay, thank you. You may proceed.
Thank you, and good morning, everybody. Thank you for having me and having Taibu here with you today. Just going to share a little bit about the work that we do at Taibu, and just give you a little bit of background about who we are, how we came to be. So our mission, vision, and values are here. I want to highlight our values of leadership, community-driven, Afrocentricity, and quality, and really working with community, with partners, with agencies, governments such as yourselves, to really have an impact in the work that we do. We're located in, I call it deepest, darkest Scarborough, so in the Malvern area of Scarborough, as far off the beaten path as you can get. We're at Nielsen and Tapscott, but we've got a beautiful standalone facility where we can offer most of our services. We added the Toronto Community Crisis Team back in 2022, and that service is located at a separate site, simply because we didn't have the space in our current building to accommodate them. In addition to the services that Taibu provides directly to community, we also have a Toronto Public Health dental clinic that's co-located in our space, and so folks are able to access dental care in the Taibu site. Just a bit of a timeline of who we are and how we came to be. So conceptualized going back as far as 2004, and you can see on the slide here, in the next slide that's coming up, some of the folks who were instrumental in getting Taibu up and running off the ground, and helping us to be doing the work that we're doing today. I just want to circle back for a second to our mission. And so Taibu's mission is to provide primary health care and related services to the Black population across the Greater Toronto Area and residents of the local community of Malvern, recognizing that systemic oppression has fostered conditions of ill health and so on. And so I just want to call out the fact that Taibu is unique nationally in its mandate to serve the Black population. There is no other community health center that has that mandate. Community health centers tend to be, not exclusively, but tend to be geographic based, so they serve a local population. There are some that serve an Indigenous population that goes maybe a bit beyond geography, but we have that unique mandate of going beyond our local Malvern population and serving the Black population across the breadth of the GTA, as big as the GTA is. Taibu is an award-winning community health center, and you see here in 2022, we won the Scarborough Hero Award for a lot of the work that we did during the COVID pandemic and some of the impacts that we had. And even our new service, the Toronto Crisis Response Team, has won an award and been recognized by community for the important work that they do. And so the Scarborough Community Legal Services Clinic has recognized the Toronto Community Crisis Response Team. Just a bit about our client profile and the ethnicity of our client profile. So the majority of the folks that we serve are Black. We cater to a Black population. Our services are often created and crafted around Afrocentricity. But in addition to that, we have other populations who live in the area who access our services, and you can see some of that breakdown here. Additionally, as with all healthcare, and community services, you can see that women tend to take advantage of opportunities more than men. Bit more of our client profile by age and ethnicity. And again, you can see here across all age demographics, Black folks are the majority. And Taibu serves folks from cradle to grave. So we have, the very young newborns that we see in the clinic, right through to the very old. We use a model of prevention, restoration, and advancement. So really trying to catch people before they get to the wall that cause a crisis. So you see this graphic here that our CEO, Lieben, loves to use, but getting rid of the safety net and really preventing people from even getting to that wall. And so using the social determinants of health to help us to be able to do that. And we're able to do a lot of that work during the pandemic. There was additional funding that was provided by various levels of government to support different types of work, and a lot of that has now gone away. We use the Alliance for Healthier Communities, who we are a member of, their model of well-being, and you see that here. And so this is something that guides our work, as well as our Kwanzaa principles. And so we've incorporated that Afrocentricity, as I said, into the work that we do. Here's our model of Black health and well-being. So you can see our goals: prevention, restoration, and advancement, our principles, our practices leading to better health outcomes for our communities. And I'll talk a bit more about the work that we do to try and do that. So some of the main components of our services at Taibu include primary health care, and you can see some of the work that we do in that area, prevention and management of chronic diseases. And so we know that there's certain chronic diseases that are disproportionately impactful for Black populations: diabetes, hypertension, sickle cell, and Taibu has programs that support those programs. We do a lot of health promotion, so physical activity, nutrition and education, mental health and stress management, wraparound supports, and age-appropriate programs. As I said, we've got programs for the very young and programs for the very old. And then we've got community development and capacity building. And that's a big part of the work that falls into my portfolio, so community engagement and participation. So I think it was said earlier, nothing about us without us. And so really working with community to understand community needs and building programs that support community. And having community lead the programs that they want. And that is so very important for continuity. So generally when a program is community facing and community led, that program will continue because the community recognizes the importance of having it. Food security increasingly has become an issue, as you know, coming out of the pandemic. Prior to the pandemic, we had a program called Taibu Eats that we run every Wednesday out of our space. It's a social networking program, so folks can come in and have a meal, but also have some fellowship time with each other. And that program, prior to the pandemic, was serving about 120 to 150 people on a weekly basis, and we're now pushing up around 250 people every week accessing that meal because of the need for food, but also because of the need for socialization and less loneliness. And in June of last year, so almost a year ago now, we started a local food bank to give access to community to food in partnership with Daily Bread Food Bank. And again, that started out at about 70 households, and we're now up to about 250 households accessing food in that food bank. And it is a limited food bank, so it's only clients of Taibu and the local area where the food bank is, which is Empringham, that can access that food. As Mo mentioned, we do a lot of work with faith-based organizations, both locally in Scarborough, but also throughout the city. We have a partnership with CAS. So the Toronto Children's Aid Society, and a new partnership emerging with the Catholic Children's Aid Society as well. And SAPASI was also mentioned earlier as a program that is housed at Taibu. And in addition, we also have Indigenous programming that's offered at Taibu through flow-through funding, and the Indigenous elders are the ones who determine how those funds get spent. Youth programs are an important component of the work that we do, especially as it relates to youth mental well-being. We have a YAO and an EYAO who is Black focused, specifically the EYAO is, and so works with Black youth who are in need of any kind of wraparound support. We have a couple of projects that have recently wrapped up their funding cycle. So the Amara Generation Project and the Plug Project are those two projects. The Amara Generation Project is a youth-led, youth-designed Black mental health project for youth 15 to 24. And what has come out of that is the development of an important Afrocentric focused toolkit and healing circles that will be rolled out in the coming months. And the Plug Project is a Education Act intervention project that focused on upstream prevention of Education Act issues, but also downstream working with youth who were either facing or expelled or suspended from school and getting those suspensions reduced or expulsions overturned. And during the pandemic, when this project first started up, we weren't seeing a lot of that. But in the last 2 years, we saw quite a number of Black youth being pushed out again, and we had 100% effectiveness at getting suspensions reduced and expulsions overturned and student records cleansed. But it is very, very in-depth work, working with students who are facing, and their families when they're facing suspensions and expulsions. And I did the math on the work that we did, and the average number of encounters required with any youth in expulsion or suspension was 130 contacts over the course of dealing with them. And so, just recognizing the amount of work that has to be done with one individual to get them settled and get them back into school. One of the benefits of the Plug Project is that it came with a legal component funded through LAO. And so that allowed us, where necessary, to access a lawyer to advocate for, attend hearings on behalf of students and families when necessary. The Learn Project and From School to Success projects are ongoing projects at Taibu, again, both focusing on Black youth. Learn is a mentorship program where students can attend at Taibu on Tuesdays, in Durham on Wednesdays, and virtually on Thursdays to get help with socialization, with homework, and so on. Very respected program in the community. And then the From School to Success Pipeline Project is a youth-focused project dealing with NEET youth. So working, having the young folks between the ages of 15 and 29 design the system interventions that they feel would be most valuable to them and getting them reconnected into society, whether that's around education or employment and entrepreneurship opportunities. Taibu is an accredited Francophone program service provider, the only one in Scarborough. And so we have on staff folks who are bilingual and who are able to service, and we see a lot of African and Caribbean Black Francophone folks accessing our services. I mentioned our Indigenous mental health programs, and then our community systems change programs. We've been doing a lot of work over the past several years with our friends here at CABR and doing, I think, very meaningful work. So one of the first projects that I started working on when I got to Taibu in late 2019 was the consultation that was being done with the community around the Toronto for All campaign, which eventually led to Black Mental Health Day, which has now evolved into Black Mental Health Week. And so that was from community. Community told us what they wanted in terms of recognition of mental health issues that they face. And they identified that, February in itself is hard enough. They didn't want a recognition in February. They wanted something to stand alone, that recognized how anti-Black racism impacts the mental health of folks. And so initially the first Monday in March was designated as Black Mental Health Day, and that has evolved into a full week of activities where we recognize and talk about the Black mental health issues faced by our community. And just a sampling of some of the posters that were developed for that initial campaign. They were translated into multiple languages and involved community right across the city. And emerging to include communities across the GTA, so it's gone beyond the city of Toronto. We've got other cities in the province declaring Black Mental Health Day. We get calls all the time from people wanting to know how this works, and it's even gone national. We're getting calls from Vancouver and Halifax and so on to understand the impact of the work. I mentioned our From School to Success pipeline and systems change and the Plug project. So I touched on these already, but just the importance to recognize Black youth mental health. I had a conversation yesterday that floored me. I was speaking to one of our correctional institutions here in Ontario, and they told me they had a population of 750, the oldest being 85, the youngest being 18. And I asked the question, how many of them are Black? And they said 68% of that population is Black. I don't understand how that's possible. So they want to work with Taibu to provide services to their client, or to their clientele, to their inmates, but they have no money to provide any kind of service. So any service that we provide would have to come out of Taibu's coffers. But Taibu never says no, and sometimes that's to our detriment. So we do a lot of work where others won't do the work, and that work is often around systems change and trying to engage with the various systems that negatively impact our Black populations and having significant results in those systems. So we've worked with the school boards across the city. We have MOUs with school boards in the GTA, including the TDSB. We have been at times close to an MOU with the Toronto Catholic Board, but still nothing signed there yet. But we also have MOUs with the Durham Catholic Board and the York Region Public Boards. So, there's recognition in a lot of the systems that they can't do the work by themselves, and they need assistance from organizations like Taibu and others to be able to have that impact with their Black constituents. And that's where we shine. We provide various types of culturally appropriate services, including lifestyle modifications. One of our signature programs is the Black Mental Health Challenge, the Black Men's Health Challenge. It does have a mental health component to it. So we make sure in a lot of the work that we do that we want to include that mental health component, recognizing, again, the disproportionate impact that anti-Black racism has on how people react, respond, interact in society. And the most recent addition to our services, obviously, is the Toronto Community Crisis Service. And Mo and Michelle, spoke about this, so you have a good understanding of that work. That work is in the process of being expanded to Scarborough-wide, and I know my colleague Raquel is working hard on that implementation. And here are some of the numbers that we can see for the first 2 years of the service. We don't do our work alone. We work in partnership and collaboration with a lot of folks, including the folks here at CABR, so the city, Trillium Foundation funds our From School to Success Pipeline Project, the Black Health Alliance, who are the parents of Taibu per se. We do a lot of work with universities and colleges as well. Sister and brother CHC, so Women's Health and Women's Hands, Black Creek, Parkdale Queen West, Rexdale, and amongst others. And then you see Center for Young Black Professionals, working with youth, working with the Toronto Police, Ryerson, York, and so on. And so that is my presentation.
Thank you.
You're welcome.
Any questions for Phil? Go ahead, Wally, 5 minutes.
Thank you, Phil. Phil, there are two things that I wanted to raise with you. The first one, in your presentation, you talked about supports you provide to boards on a system change level. So, and I'm glad you're working with so many partners, including the Legal Aid Clinic. So my experiences have been, dealt with complaints from Black staff about anti-Black racism. I serve on the board, right? So, it's a fiduciary responsibility to take those concerns very seriously. Do you provide support at a governance level when it comes to addressing anti-Black racism or systemic change? So that's the first question. The second question is, Pride is just around the corner, next month. And I'm wondering if you have programming or services that focus on the LGBTQ2I, sort of membership of the Black community, just general community. So if you could help us understand more of the work that Taibu does, that'd be greatly appreciated. Thank you.
Thank you for the question. And yes, we have a Pride event planned in partnership with other community partners for June the 7th. So that's a Friday. It's going to be held in the parking lot of the mall where we're located. And the idea is to build on the work that's been done over the past several years at different locations in Scarborough. So we're going to have events, activities, vendor booths, and so on. We're hoping to make it the biggest and best that we've had so far. And so in the process of planning that with MFRC, Strides Toronto, Scarborough Boys and Girls Club, and other organizations are also involved in that planning. So Taibu is also in the very early stages of doing an assessment of how we are perceived in community by the 2S LGBTQI community. So we've just engaged with an agency to help us do that work. And I have a meeting with them actually later on today to start the process of staff and community engagement with them. And so the idea is that, we want to see if we are accepted, recognized, appreciated by community, and if we're not, how do we move the needle to get there? To answer your first question, we do offer support at governance levels. So we had funding that stretched from, I want to say, 2019 to 2023 through the city. And that funding is now lapsed. We continue to do the work, but we certainly can't do it in the way that we did it before because we don't have direct funding to do it. But again, we never say no, so we try to find ways when asked to provide that service.
Okay, thank you. Any further questions? Okay, seeing none. Speakers on the item? Okay, Wally, 5 minutes.
Yeah, I'm glad you raised the point of funding. And one of the things that we're hoping to do as an advisory committee is look at the city budget and seeing how it's resourcing our collective priorities in addressing anti-Black racism across the city of Toronto. So I just want maybe to ask my colleagues is we need to think about which programs and services that are offered by our partners, such as Taibu, which funding is lapsing, and what's our sort of plan to ensure that these organizations are resourced in a sustainable manner in the long term, because I believe Taibu plays an integral role in not just in Scarborough, but also, what you've learned through your experiences working with community is something that's shared with your Toronto Community Crisis partners as well, right? So I'm hoping that when we do have the conversation related to the city budget, we look at organizations such as Taibu, and whether there is funding that's been made available by the city. And I hope I could have posed this question to my friend, but what are the lapses on the provincial and federal level? Have you received support from the federal and provincial government as well? So that's something that I hope we could collectively explore. Thank you.
Yeah, thank you.
And yes.
Sorry, that was is speaking. There's no further questions. Sorry. I will, in closing, will just say that I've had the privilege of working with Taibu for many, many years. When I was co-chair of the Black Student Achievement Advisory Committee at the TDSB, Taibu had a seat at the table, and they contributed significantly to the enhancement of Black students at the school board. One of the things I did as a school board trustee also was I sat on the expulsions and suspensions. That's one of the responsibilities of a school board trustee. And even though 12% of the student population in the TSB are Black, over 50% of them are overrepresented when it comes to expulsion suspensions. And that's something that I worked to help change. But I bring this up because, again, people who had influence, who were suspended, used to have lawyers and so forth accompany the parent and the student to an expulsion suspension. But of course, the Black community, didn't have those deep pockets. And so Taibu actually stepped in and accompanied the parent to actually help defend whatever the cause may be. So again, I've seen your work in the firsthand and the value and of the work that you do. And so we at this table hope to continue to support Taibu in any way that we can. So thanks again for your presentation. I will ask Mr. William to move this item. All those in favor, for a seat.
Yes, but Chair Queenie had a hand up. I think you missed catching her eye online.
Sorry, somebody was,
Yeah.
my apologies. I did not see that because my screen was off. Queen, go ahead. You want to speak to
Yeah,
the item?
I just want to echo your sentiments and thank Taibu for presenting. I was a provincial youth outreach worker for many years in Scarborough as well, and had the pleasure of sending youth referrals to Taibu for services. And I'm just glad to see that they're still around, and I'm sending wealth energy your direction. And I hope that the services are able to expand across the city as well. Sending funding your way.
Yeah, thank you. And Dr. Newton Thompson, I think you want to speak to this item? Or was I mistaken?
No, I was voting.
Oh, okay, wait, okay. So it's moved by Mr. Williams. All those in favor?
Yeah, I still share before we go
You want to
there.
speak as well?
Yes.
Okay, sure, go ahead.
Yeah, sure. Before we go there, I was really interested in hearing his remarks about the communication from Walid about the funding, especially on the federal level for this work. Maybe just shortly.
Well, procedurally, we ask questions and then we speak. So unfortunately, we've passed that point. You can answer this offline if you like, but just
most obliged, Chair. Okay, I move the motion.
Okay. All those in favor? Opposed? Carried. Thank you. And we're on item number 4. An overview and consultation Toronto's expanded free public Wi-Fi strategy. We have Alice Zhu. Perhaps you could help me pronounce your name properly. Director of Digital City is here to make a presentation.
Hi, everyone. Good morning. I know it's only 2 minutes left of the morning, and I'm standing between you and lunch. So I will give you the overview, but really looking forward to hearing from you. My name is Alice Sue, and with me is Melissa Kim. We both work in technology services, and we're really grateful for the opportunity to have this presentation today and to hear back from you. We're here to talk about a program called Connect-TO and a specific part of that program, which is around expanding the city's free public Wi-Fi and the work that we're doing on that strategy. Thank you. So on the agenda, we have 3 topics for you, which is giving you an overview of the current state of free public Wi-Fi in Toronto, letting you know more about the consultation approach that we're taking, as well as proposed strategy and discussion. And from that discussion perspective, we're looking forward to hearing your thoughts on, specifically from your perspective, you know, are we going on the right track with the way that we're approaching the strategy and the consultation, as well as looking to hear from you any feedback you have on the actual strategy. So all of this work is based on the need to address the city's digital divide. So the city of Toronto is one of the most connected cities in the world. From you know, we are the technology leader in Canada. We're certainly the financial leader in Canada, but at the same time, a lot of people in Toronto are being left behind in what we call the digital divide. And what we mean by digital divide is that gap between those who have affordable internet access, have the skills, have the devices, and those who do not. And more each day, we're finding that, you know, digital connectivity and technology that comes with it is an integral part of how we live our lives day to day. And it's no longer a nice to have that some people might think, you know, 5-10 years ago. And it's really critical and crucial in how we can actually be productive, you know, engage with civic processes, engage with community, you know, as simple as FaceTiming your family, right? That's the kind of thing that people are using this resource for. And it's also widely researched and understood, especially with Toronto-based research. It was one of them you're seeing on the screen there, is that this is not the divide is not equal amongst everyone. The divide is strictly, I mean, there's research that shows that divides along the lines of poverty, of equity deserving groups that are adversely affected by this particular by this particular barrier. Research is showing that when we continue to do research with our partners in academia, but for example, when we ask the respondents of Toronto households, well, are you worried about paying your home internet bills? Many people were worried, but the rates of worry were greatest among low-income, newcomer, single-parent, Latin American, South Asian, Black, and Southeast Asian residents, with Black respondents saying that they are 42% of Black respondents said that they're very worried about paying their internet bills, and you know, where the average was less than 30%. So just to give you that idea about this digital divide is along the lines of the existing disparities that exist in the city. So what are we here to talk about today is really one part of that digital equity pie, I guess, from the shape of the chart here. So we know that digital equity has other components like access to devices, digital literacy. We're here to talk about internet access specifically, and from that sector, talking about a free public Wi-Fi strategy specifically. So there's other work that is going on in the other areas and in digital connectivity and digital equity overall, and we're happy to come back another time to have another discussion, but also happy to answer your questions. Next slide, please. So the situation in Toronto right now around public Wi-Fi is through the support of Council. We've been able to add about over 100 locations of free public Wi-Fi. Majority of them are in our community recreation centers. We'll be in every community recreation center by the end of the year. And we are also in some common areas in Toronto community housing buildings, as well as in St. Lawrence Market and St. Lawrence Hall. And this is in addition to every Toronto Public Library location, which are really the leaders in digital literacy and digital equity, and they've been offering free public Wi-Fi and connectivity through computers, et cetera, for many years. So anyone in the city can go to toronto.ca/Wi-Fi and get a map of all the locations that has free public Wi-Fi, as well as information about the locations. So we also have been able to work with private companies through generous donation, to provide free public Wi-Fi in some buildings as well, like privately owned buildings. And so some of our Tower neighborhood buildings now have free public Wi-Fi through this donation and the ongoing donation. With that work, we're able to also work with the CE Center for Black Professionals to bring training to 10 youth who identify as being Black into those communities, and to give them some training on both soft skills and hard skills. And we're happy to say that that training was successful, and some of the youth have since gained employment in technology. So this is our wraparound way to find ways to not only bring the physical infrastructure, bring the Wi-Fi, bring the connectivity, but also all the other work that's going on in the city to really have those wraparound supports for the community and move digital equity forward. So today we're looking at, we're in the middle of those 3 phases of the public Wi-Fi strategy. We've done some work in that first phase. Now we're doing the public consultations, as well as stakeholder engagement tables like this. And then later this year, we'll be completing that to create that strategy and then start to implement that strategy. So we have a few different ways to hear from the community so that we understand the situation from their perspective, get feedback on the way that we are approaching this, and really making sure that the solutions fit what people are experiencing in the community. And so, for example, we're working with SDFA's Community Development Unit, you're hearing a lot about them today, to conduct 14 community-led discussions that's spread around the city. Essentially, what happens is the community groups receive a discussion guide. They have the discussion, and then they give us the feedback. One of the groups that we have engaged through this process is the Federation of Black Canadians, and we will be going out to them with this package to get their feedback specifically. And so overall, the community organizations have been selected to make sure that we have representation and that we're able to hear from everyone. We also have some public consultations as well. So 2 in-person consultations, varying locations, east and west of the city, different times of day, as well as virtual sessions, different times of day. So of course, everyone's welcome to attend those. We'd be very grateful if you promoted them as well. Thank you. What would be in the strategy? Very brief overview. I again don't want to keep you from lunch. Essentially, our vision is, how do we ensure that we are very good at building physical spaces to bring people together, right? So the city has a lot of experience with that. But now we're talking about building digital spaces with that same mindset. So how do we make sure that there is a seamless connection between the physical and online experience in public spaces in Toronto? We're looking at this in 4 pillars. They are universal public access, digital equity, user experience, as well as innovation and culture. So on the public universal access front, thinking about how do we provide everyone who are coming to the public spaces with Wi-Fi to conduct businesses they wish to conduct. And so we have a number of priorities listed here for public consultation, as well as some proposed actions. So For example, thinking about the various spaces, or outdoor spaces, what people are looking for. Is it indoor spaces? Is it, places where community gather but are not city-owned spaces? What are the areas where this can be really helpful? The next area is digital equity. So as I mentioned earlier, how do we make sure that we bridge the digital divide for that community impact? And so how do we make sure that we bring the Wi-Fi to those who need it the most? Thinking about how do we let people know about this as well? I know this is the question that the committee has asked earlier. So bring this information when you're going to get newcomer services. Here's some information about where you can get access to public Wi-Fi, et cetera. So how do we do that better? As part of the strategy. Number 3 is user experience. So we know that the service needs to be easy to use. It needs to be, of course, accessible to everyone. And we want to make sure that it's something that we have mechanisms so people can give us feedback, because technology changes, people's use case changes. So, how do we make sure that we continue to hear back from the community and make sure that it works for them continuously? One thing that's different about, free public Wi-Fi than what you might get from the city than what you may get at a McDonald's or a coffee shop or something like that is, we take privacy and security extremely seriously. So we do not keep private information. We make sure that the security protocols are up to date and are able to make sure that everyone, as much as possible, are free from harm. So that's part of the reason people might say, well, we can just access it at these other places, but it's actually, it's a different product when it's a public service. The last area is exciting, is innovation and culture. So how do we allow creativity, innovation to grow with technology and with access to digital means? This is an area where we want to look at partnering up with local communities as well and BIAs, et cetera, to make sure that we are able to use, to take advantage of this connectivity. So thinking about things like showcase projects, cultural expression, et cetera. Great. So the last slide here is just that those discussion questions I'd mentioned earlier, based on what we talked about today, are there any immediate gaps or concerns that you see with the way we're approaching this? In addition to the ways that the discussions I mentioned, are there any other avenues for consultation with the Black community we should consider? And then lastly, really interested in hearing what unique challenges, so for example, intersectional barriers, this community may face that we should know about. Thank you so much.
Thank you. Effia?
Hi. So I saw that you guys had mentioned that you guys would be having consultations with the community. I believe 2 to 4 p.m. in person in Driftwood, and then a 1-hour virtual session. How have your virtual sessions been going for you guys, if you've done them in the past?
The virtual sessions haven't started yet. They are in, May 30th is the first one. And then that's the evening one. And then we have another afternoon one on June 18th.
Okay, so due to experience, I'll say that I doubt your turnout will be high.
Okay.
Just because with anything, now that we are able to actually go outside and do things, a lot of people don't participate in virtual consultations and things like that. Yeah, so I know that you do have the 1 hour there, but I would also encourage you guys to go into other spaces where people are, rather than having them come specifically for this, because while people do need it, oftentimes people don't do what they need, if that makes sense. And so going into spaces where people are already gathering,
right,
and asking them questions there might be more helpful, and you may get more actual feedback. It would be nice for people to come in and say, okay, this is what we're talking about. This is what it affects me, so I want to be here. But in the community, especially that I work in, that usually doesn't happen. So that's my recommendation, that you go into spaces already set up for maybe other things, and partner with community organizations that are running things, and potentially ask those questions or set up booths for consultation in those spaces.
Okay, thank you very much.
Okay. Wally, go ahead.
Thank you for your discussion questions. Very thought-provoking. When I went through your presentation, I was really surprised that a city-funded initiative in Regent Park, actually, during the first weekend of May, I took residents from across the city on a tour of Regent Park, and the Regent Park Tech Library stood out. And I love that initiative. It's an initiative where residents can borrow laptops, iPads, Wi-Fi sticks, and connect to the internet. And I loved how intentional that service was, and I hope it's offered across the city of Toronto, not just in Regent Park. So I'm hoping you could talk about initiatives that are, very targeted to help us meet the gap. The one question I have is, what are your thoughts of having free Wi-Fi in the subways? Instead of us going through Rogers and Bell and Fido, and wouldn't it be an amazing investment by our city to ensure that everyone has access to the internet in our subway system, in spaces that are underserved when it comes to access to the internet? The other thing that I would like to talk about is literacy, specifically when it comes to technological literacy. I didn't see much information in your presentation about that. Young people, are fascinated by crypto and other, technological, forms of currency. And is there an appetite from your department to work with youth groups to unpack that so that, we could prevent people being taken advantage of, right? Scams, how to prevent, someone spying over your technological devices by downloading, spam, basically, from links from spam, like stuff like that. You asked a very important question, and that is, what are the intersectional barriers? So as you might not be aware, but members of the Black community in Toronto and in Canada, like many other communities, we have folks who are affluent and have a lot of money, but a lot of folks also live under the poverty line and do not have access to technology that make it possible for them to access city services or provincial services or federal services. So there's that intersection when it comes to poverty, and that's very important, but also when it comes to access to health, specific needs. A lot of bookings happen online, and I think it's important for us to consider the implications of the challenges that exist now, especially because of the pandemic. It's taught us a lot. There are gaps that need to be filled. So I'm hoping you could speak to any of those concerns, and hopefully when we have a much more of a discussion, and we'll talk more about innovative solutions. Thank you.
Thank you for the question. And I'm really grateful you're so thoughtful about this. And it's some things, what you've mentioned is there are definitely things that we've been working towards. On the question about on health, there was just a study that came out in the States, only one, so I'm not sure if it's, just keep that in mind, is that, digital connectivity is now a super social determinant of health. And that's going to happen more and more, I think, just the way that digitization is happening. In terms of the programs that are in place, as I mentioned at the beginning, I'm here to talk specifically, seeking your feedback about the public Wi-Fi strategy portion today, but there are other programs that we have on the go around digital literacy and digital equity overall, and we're proud of that work, but there's always more work that can be done. For example, we are really proud to work with Toronto Public Library. In 2019, we received a council directive to join the city's Coalition for Digital Rights, and through that, funding for community librarians, just 2 of them, in our community librarian program to bring digital literacy skills to people in the community. So, for example, we're having free public Wi-Fi put into seniors housing. That common area now becomes an available space for those community librarians to do digital literacy teaching, etc. And so sometimes we're lucky enough to have donations and devices are donated, etc. But again, we can't continue to depend on donations for this kind of work. It's got to be sustained and ongoing. But digital literacy is going to be, I think, a real game changer for us going forward. Youth for sure, but also older adults. There's this misconception sometimes that older adults don't need connectivity, but that's not true at all. And so how do we keep everyone safe online is a huge question for us. And so again, we want to continue to be resourced, to work with the librarians, to be able to bring that into the community where it's really needed. I can go on about the different programming, but that's definitely part of what we're looking towards as a digital equity overall, with this public Wi-Fi being a component and an enabler.
Okay, thank you. Next is Amanaya, go ahead, 5 minutes.
Amanyire.
So-
Amanyire.
Amanir, sorry,
Correct, thank you.
my apologies.
Thank you so much for the presentation. My concern is about privacy and data protection. I was thinking that you talk about some strategies to ensure safety in terms of using public Wi-Fi. For example, if I'm doing online banking and I have some sensitive information and I'm using public Wi-Fi, there has been issues of saving information. So what strategies are you looking at in terms of protecting the public as they access this public Wi-Fi you are trying to roll out?
Thank you for the question. So safety and security for the public is always at the forefront of the way that we provide any public service. And I want to be clear that public Wi-Fi is always going to be less safe than a private home connection or a VPN. So that's what I want to emphasize. There's inherent risk with any public Wi-Fi, including ours and any other one that you may access. But what the difference is, we are, because we are linked with, we are able to work with our Chief Information Security Office. We're able to continue to upgrade our systems to ensure that our processes are as secure as possible. But I do want to answer your question about banking, sharing personal information. Public Wi-Fi is always going to be a worse option than a secure connection or through a VPN.
Okay.
Thank you.
Thank you. Amaniya. All right. Thank you. Shannon, you have 5 minutes. You want to speak to something? Okay. If it's not a question, then you can speak to it after. Any other questions? Anyone online? Go ahead, Dr. Newton Thompson. 5 minutes.
Thank you. Thanks for the presentation. Can you hear me?
Yes, we can.
Okay. I have a few questions. I wanted, first of all, to find out about the team that's doing this work. What's the racial composition or the diversity of the team? I'll just roll out my questions and then you can just answer them. The second question, I was happy to hear that you trained some 8 Black youths in the technology, but I was wondering how you selected those students for training. And, I know this is kind of a strange question, but how do you know they were Black? Because I've seen in other places where people say they're training Black youth, and then when you check, they weren't really Black. So I just want to know about that. And then regarding the public consultations, I noticed that you have Driftwood and you have Heron Park, and those are 2 locations, but I was wondering whether you would be going to other locations where there there's a concentration of Black people, or whether you were going to just stick with those two locations, and why. And those are my questions.
I'll answer them in the order they were asked. The first question is, I think, about the composition of the technology services staff team. And that to answer that question, generally speaking, we are a fairly diverse team. We're doing well in that area, but we can always do better. So one area that we're focused on as a technology team is gender diversity. This is a challenge that many other technology and IT organizations face as well, and we are looking at specific tactics to address that and other diversity in staffing so that we can really have the benefit of the voices at the table. Your next question is about the 10 youth that were trained through the CE Center for Black professionals, young Black professionals, and the selection process was done in partnership with the center, and it's specifically 10 youth who identify as being Black. So they were originally 7 males and 5 females, ended up being 10 graduates, 5 males and 5 females, and the communities that they were selected from were the areas where we're providing that free public Wi-Fi through this donation. So that's how the selection process worked out. And the actual training was done through, again, the CE Center for Young Black Professionals, but also with the support of Toronto Public Library, the City of Toronto, the Cisco Academy for et cetera. So that's how the program was done over the 12 weeks. And lastly, your question on, where the locations of this, of the public consultations are held. One thing is we have an online, so if anyone can go to toronto.ca/Wi-Fi strategy, there's an online feedback form that we're gathering information, hopefully from everyone, across the city. So that's the main way we think we're going to get public feedback, is through this survey, basically live. There are going to be locations across the city where we're having those community-led discussions I mentioned earlier, and they're across the city. And so we hope that those 14 community-led discussions is also going to give us a good overview of what the community needs. And then lastly, the online the 2 online hours are also available for us to take feedback. But we're also having lots of discussions with community groups like ACORN, like Toronto Youth Cap. Like, we're having a lot of different discussions beyond these community-led conversations and the public consultations. So we are very happy to have more of a one-on-one discussion with any other groups that will be willing to give us their thoughts.
Thank you.
Can I say something?
You want to ask one more question?
I just want to make a comment. Thank you for the answer, but the comment I want to make is that if you're addressing digital divide and you're saying go online, it's just like Rogers not working, and then they tell you go online to check when it's not working. So I wonder about the more physical consultations in particular areas.
Okay.
Thank you.
Thank you. Before I leave, I'm going to ask for a motion to extend. We're on the second last item of the agenda. Perhaps, Wally, okay. All those in favor to extend till the end of the agenda? Opposed? Carried. Thank you. Next on my list is Shannon. I have a meeting with the mayor and the city managers. That's why I have to leave. Sorry. But Shannon, you're next. 5 minutes.
Thank you. My comment was just in response to one of your last questions. Sorry, I'm just opening it up. The unique challenges, just in commenting further on the consultations that you're hosting, I would agree that I think 2 in person feels limited, and especially as we're speaking about access, the online consultation doesn't feel necessarily as helpful. But I also wanted to comment specifically, maybe in those consultations, thinking about, I'm sure you are thinking about sort of what locations, this expansion will roll out across. I think one of the things, so I'm an urban planner and designer by training, and so one of the things we look and think a lot about is third space. So, this space outside of home and work. And I think as the city becomes more privatized, we lose more of those spaces. So I think as you're thinking about, you mentioned McDonald's Wi-Fi. I actually think as you're thinking about rolling out this strategy, there needs to be more consideration around public-private partnerships in terms of locations, because a lot of the third spaces that people are using these days are private or semi-private spaces. And so I think, the Toronto Library is a very good place to access some of these services, but the hours don't always align with the hours that people would need to access them. And I'm thinking through, for example, if I was using City of Toronto Wi-Fi to work on something for work or applications or whatever the case is, I would want not necessarily to be in a park to do that. I would want to be able to sit somewhere. So thinking through maybe some of what that public-private partnership could look like in terms of spaces, and also just sort of seconding the comment about the TTC, I think that space in particular does act as sort of a third space right now in this city. So thinking through that more broadly, I think could be helpful.
Okay, so Kathy, go ahead if you want to speak to the item.
Thank you. I'd like to echo Shannon's comment about doing some focus on a third space. I do like the idea of the public-private partnership, but I do want to encourage public spaces, even if they are indoor spaces that have open for long hours, that often, I do a lot of work at a coffee shop, but you have to buy a cup of coffee in order to do the work there. And so if we're talking about accessibility, we want to make certain that there are spaces that are open for extended periods of time that don't require a purchase in order to use the space.
Thank you, Kathy. So before we continue, if I could just ask those online to turn on their cameras for quorum purposes. Okay, Waleed, I believe you wish to speak to the item.
Thank you. Yeah, I'm hoping you can answer my first question, which is, what do you think about Wi-Fi in our subway system, public Wi-Fi offered by the City of Toronto? So that's the first thing that I was hoping you could speak to. The second is innovative, intentional initiatives that are targeted, specifically in communities, probably with a large, Black Torontonian population, but other marginalized groups as well, where we do have that technical divide or technological lack of equipment due to poverty. Folks that might want to rent a laptop or an iPad to be able to access city services, right? So what do you think about initiatives like that across the City of Toronto? I spoke about the Regent Park Tech Library being one example. And lastly, has your department, or is there a campaign that speaks to the importance of public Wi-Fi? What are the benefits of public Wi-Fi? When I think about such initiatives, they do require resources. So I think it's important for the public to be supportive of such initiatives. So if you could just comment on those three pieces, that would be greatly appreciated. Thank you.
Chair, I wasn't sure if this was a question period, or are we on speaking?
We have moved to the speaking portion, so we'll close any questions, Waleed, unfortunately.
Okay, thank you. I didn't know that. I thought I had an opportunity to get a response. But I think when it comes to my remarks on this item, we need to examine the digital divide in our city, specifically with those with initiatives that are very innovative, that meets that gap, and the resource implications. Hopefully, when we do talk about how is the city budget investing in addressing anti-Black racism or initiatives that help us bridge that gap. And I think it's important for us to think about innovative, targeted programming or initiatives that help us address that gap. So I just want to thank our friends for joining us today. I really appreciate your presentation today.
Are there any other speakers to this item? Okay, so hearing no further speakers, can I have a motion from EFIA to receive the item? All of those in favor? Any opposed? Okay. So we'll, pardon me. Okay. So we're going to move on to the final item for today. The last item is increasing equity and access social policy strategies and initiatives at the City of Toronto. So members, this is a deferred item from the last meeting. I would like to move another motion to defer this item to the next meeting, given that we don't have a presenter to address any specific questions from members today. Waleed, okay, would you like to receive that? Okay. Oh, okay. Yeah, so we'll just defer the item. And all those in favor? And all those in favor of that, just a show of hands, please. Any opposed? Okay. Motion carries. Thank you so much, everybody. So that concludes our business for today. Thank you, members, staff, and presenters. The meeting is now adjourned.